going to talk with you for a few minutes about policy challenges. At the same
30 minutes. Yeah.
issue that's only
Pokoknya hari ini, yang sesi panel ini tentang policy and future directions terkait isu climate change, climate action, dan kawan-kawannya.
It will be journeys in enggak
Gondrong
rambutku rontok.
lebih cocok gondrong sih kalau.
Rambutku ini rontok tuh, terus meh tak botak. Terus
WHO recognizes
dokter itu udah dikira sakit karena mengurus. Nek dibotak rak medeni, tambah medeni.
Itu kan French crop atau basket.
Nek dibotak rak yo orang makin berpikir macam-macam. Jadi nggak usah di ini. Satu nggak apa-apa? Oh, aku tuh masih kurang 7 kilo loh ini.
the primary focus is on adaptation. But if the countries
Okay, so everyone, good morning and welcome back to the Summer Course 2024. And today you will join two panels regarding the Summer Course 2024. The first panel will talk about policy and future directions for climate actions, and the panel 5 will talk about integrated approaches to climate change adaptations. In panel 4, we have 4 speakers from national and also overseas speakers. That this panel will be led by one of our lecturers from Department of Health Behavior, Environment and Social Medicine, Dr. Bagas Suryo BIntoro, Ph.D. For the next around 3 hours, I will give the stage to Dr. Bagas. Time is yours.
Thank you, Mas Yopi. So, good morning, everyone. Welcome to panel 4 on policy and future direction for climate action. I'm Bagas from Universitas Gadjah Mada, and it's an honor to serve you as a moderator for this panel. I have to say that I ran to a few of you in the elevator this morning, and I saw a lot of you using the fan. And it's we're feeling the heat lately now, and this is also things that match to our discussion here. We are gathered to talk about the climate change, and it's giving us a real reminder why these discussions are so urgent. And so thank you all for joining the session, and let's hope after today's panel we will leave the idea that will bring more solution to the climate change. So I would like to remind you about the house rule before we begin. Speaking time, each speaker will be dedicated a slot of 30 minutes to present their insight. We will notify the speakers and in 5 minutes remaining of your time. And after that, we will have Q&A. To maintain our schedule, I kindly ask of all speakers and attendees to remain within the allocated time. So without further ado, we would like to introduce our first speaker, Dr. Ruandha Agung Sugardiman. Dr. Insinyur Ruandha Agung Sugardiman, Master of Science, is from the Ministry of Environment and Forestry of Indonesia. Dr. Ruandha will be discussing government regulation and policy in overcoming the impacts of climate change. With extensive experience in environmental policy, Dr. Ruandha plays a pivotal role in shaping Indonesia climate policy and landscape. Please join me in welcoming Dr. Ruandha.
Tes, ya. Good morning everybody. Kok bisa dikerasin lagi mas? Harus tes, tes, tes. Halo? Ya. I have to force to make us. Ya, tes, tes, ya.
Yeah, maybe this is real.
Okay, thank you Pak Bagas. Yeah, it's better. Good morning everybody. Yeah. Hoe gaat het met jou? I've been in Netherlands for 8 years. Yeah. Yeah. Yes, today I will present my topic about the government regulation and policy in overcoming the impact of climate change. Yes, I'm directly to go to my presentation. Pointer, Mas. Ya. Ya, saya dari sini aja, Mas. Ya. Okay. I start with a triple planetary crisis. So the global now facing this crisis, climate change crisis, air pollution crisis, biodiversity loss crisis. And even the Secretary General of United Nations said this is now to threaten the well-being and survival of million people around the world. So it's a code threat for humanity. So students, you ever see this building? It's a greenhouse. What we are feeling if we go inside of this building? It's hot, yeah. It's hot. It is the same condition when we inside in the car in the parking area and all of the window and the we close it and the feel hot for 5 minutes. We feel hot already, and this is happen in our Earth and our planet. So because of the increasing the concentration of CO2 or greenhouse gas in the atmosphere, so when the electromagnetic energy from the sun through the atmosphere, they cannot send back to the outside in the sky. So the global temperature become hot and hotter. Yes, the greenhouse gases, there are 6 here. The most important thing is the CO2 and CH4. So carbon dioxide and methane. So this is increased by abnormal rate infected by human activity. In negotiation, we call it the anthropogenic factor. So what is the impact of this increasing the temperature? You can see from this video. Sorry in Indonesia, but I will explain by this video. Suaranya, Mas? This is data from NASA. When the temperature of global increase by 2 degrees, so the rainforest tropical will lose 40%. When the increases become 4 degrees Celsius, so the forest fire is happen everywhere, and now it's happen the desertification. Kok berhenti Mas? Ya. Yeah. If the temperature increase by 6 degree, so the planet cannot be for the human life. It's not suitable for the human life. Next. Yeah. So what is the impact of climate change for our life? So the negative impact, the climate change for our life is all of the aspect of life is already impacted. The agriculture, species, habitat, water resources, forestry, coast and small island, and health, what we are discussing today, now is already impacted by climate change. So this is the long story of Indonesian commitment to climate change. Start when we attended the COP21 in Paris, and that time all of the countries agree for the Paris Agreement to be ratified in the country. So from this one, from 2016, Indonesia already has a nationally determined contribution. So we have first NDC, and then the updated NDC in 2021, and then we have to enhance our NDC in 2022, and this year 24 we will finishing the second NDC. So from this document we also submit what we call it a long-term strategy for low carbon and climate resilient 2050. Yes, this is 5 sector what Indonesia is already commit to reduce the emissions. The sector is the energy, waste, industry, agriculture, forestry, and other land uses or FOLU. From this target, yeah, you can see here, the forestry target is about 60% from the whole Indonesia target to reduce the emission. So the biggest portion of the greenhouse gas reduction of Indonesia come from forestry. Yes, very hard to be achieve this number, but we have a roadmap to do so. Yes, to make sure that what we have already committed to international, we build the operational plan of the Indonesia's FOLU Netting 2030 for controlling climate change. This is the minister decree, and will in this book we explain about the mitigation action, how to achieve the target 60%. This is the document. This you can click this picture and you can download the document in English also. So from the document that we already submit to the international, the long-term strategy for low carbon and climate resilient 2050, there are 3 scenarios. So the first scenario, the extended NDC. So when we have a NDC and we continue with our NDC, unfortunately, our emission is still higher because the use of energy is still high. Then we fine-tune the scenario with the second scenario, the transition scenario. You can see the emission is already much lower because the use of the energy is already down. And then the last scenario, the low carbon scenario compatible with a Paris Agreement target, you can see here all of the 4 sector, energy, industry, agriculture, and waste. And here 2030, they peaking in this emission. But fortunately, the FOLU, forestry and other land uses, they has a bigger absorption. So it's not emitted anymore in this year, 2030. And when this scenario we continue, so we can much more higher to absorb the emission. So this is the sector of the FOLU. So the emission sources of the FOLU is come from peat fire, peat decomposition, deforestation, and the sinks sources, absorption sources is come from the forest plantation, reforestation, secondary forest regeneration, and annual crop. So you can see here, year 2030, the absorption is already bigger than the emission sources. This, we call it the net sink. So the absorption level is equal or to higher than the emission level. The target, the number of target is minus 140 million ton CO2 equivalent. So in this document, in the operational plan, we have a scope of this plan. There are 15. You can see here, the first row here is how we can reduce the emission. The second is how we can make some extension of our plantation. And the third, how we can maintain our forest. And the fourth line here, you can see the enabling condition, how to support this activity is happen in the field. So basically, when we call it, what is the key sector mitigation of FOLU? We can see here, there are 5 activity. And what is the activity in inside? You can see here, detail the activation. But when you ask by the people, what is the Indonesia FOLU net sink mitigation action? Is there are the big 3 activity. The first, action to reduce the emission. The second, action to maintaining the carbon stock. So we have to maintain the forests, what we have still have in the Indonesia. We still have 46 million hectare of the primary forest, and also action to enhance the carbon stock. So we make a new forest. We have to make a plantation. We rehabilitate the forest that already degraded. And also the fourth activity is in institutional development. So from this 3 activity, when we see the commitment of international, of global commitment, it's a very related with the international commitment. So the UN United Nations Collaborative Program REDD+. So there are 5 activity: reducing emission from deforestation, reducing emission from forest degradation, the role of the conservation, sustainable management of forests, enhance of forest carbon stock and development country. So when we in line with this activity in FOLU, these 2 here is very related with the reducing emission in activity in the FOLU, and the role of conservation and sustainable management of forest is very close related with the maintaining stock carbon. And of course, the enhance of forest carbon stock is very related with the action to enhance carbon stock. So back to the Paris Agreement. It's about the development. So there are pointed in the Paris Agreement, sustainable development and poverty eradication, and so on. This is also in line with what we know as sustainable development goals. So there are 17 goals. One of the goal is number 15, life on land. This is very related with the forest resources. So previously, Indonesia paradigm of the economic, social, and environmental harmony is about 3 circle. So now we shift to become this circle. So the environment become the basic of this development. So not only development, but also the prosperity we will achieve for this activity. So from 17 SDGs, and we can see the forestry is become the center of this activity. So forestry will support the achievement of these goals. So for example, social forestry will achieve for no poverty, and zero hunger is very related with agroforestry, and so on. For example, number 13, climate action is very related with carbon sink and carbon stock, what we have already talked before. And this is the SDG wedding cake. So SDG wedding cake illustrate the interconnectedness and importance of the ecological system, social and economic, to achieve the global goal. So we can see here small video to illustrate how this nexus is very related with the forestry sector. Ini ada suaranya juga, Mas. So you can see here the biosphere, the environment is most of the mist is about the forestry. Yes, we can see here the forest related with the water, energy, and food nexuses. The forestry, forest has become the center of this security, energy security, food security, and water security. And this very related with what our new president statement in the parliament, that he want to achieve this security in food, security in energy, and security in water. And all of this security is very related with the forest condition. Yes, to make sure our mitigation action is happening in the field, we have to make a analysis, the spatial analysis with the three big map. This map is come from this map, the index biogeophysics, and this is the map of optimizing forest area based on the environmental and ecosystem services index. And this is the map from the forestry management unit typology. From this three map, we make a overlay, and with the special criteria and indicator and the rule base, we can see the area where the action will be take place in the field. So we have three main locus for the distribution of priority of location in the Sumatra, in Kalimantan, and also in Papua. Of course, in Sulawesi and Java Island also there is a activity, but not the much as in this three area. So from this analysis, we can see what is the activity. Yes, what is the activity? Who will doing that activity, and in which area, and how many hectare will be taken place in the field, and how many when the area the activity will be done, and also how many dollar the activity will support. Yes, for the follow activity, of course, we need funding for this activity because it's very huge activity in the field, And from the presidential regulation number 98 2021, we have the implementation of carbon economic value for achieving nationally determined contribution target and controlling greenhouse gas emission in national development. So there are three schemes: carbon market, non-carbon market, and result-based payment REDD+. So Indonesia now is already has a stock market for the carbon, and launching by the president on September last year. And from these three sources, we already have some funding from the result-based payment scheme for REDD plus, contributing by Norway, result-based contribution. We already received the funding about 56 million US dollar. That's the first RBC, and the second RBC 100 million US dollar, and the third RBC next year will be have also about 100 million US dollar. Also from the Green Climate Fund, we got the 103.8 million US dollar. And East Kalimantan itself, they got from the World Bank, from FCPF Carbon Fund, about 110 million US dollar. And Jambi Province in Sumatra, they got 70 million US dollar. So the funding for the follow activity is already there. So the activity will be supported by this number from the international contribution. So what is the action plan we already have? So starting from 21 is the preparation, and 22 is there are many activity already done in the field for the follow activity, and this year we will finish the socialization of this action plan in the province. And of course, the activity include the information system development, knowledge management, incentive and disincentive policy. Also, the manual of development. This is include research, etc. here, and also capacity building. We have a capacity building for the people in the field directly. So, my last slides. So the follow activity The follow activity can be done with the collaboration of all of the parties. A multi-stakeholder party will contribution and activity. Of course, the government, the regulation, and the guideline, etc. Community, we include all of the community, so no one left behind for this activity. Of course, academic, business actor, and also media to involve in that activity. Yeah. Okay. This is our collaboration in the field. So we sure that our activity in the field can be achieved by the pentahelic collaboration. This is notable success in the various areas that already reported to the FAO this year, July, when the minister visit in FAO headquarters in Rome. The first, what we already report to the FAO is about the reducing deforestation rates, and then improving forest and land fire control, enhancing community access to forests, promoting conservation area by implementing result-based management, enhancing forestry governance by shifting from timber-oriented to landscape management. The sixth is enhancing peatland and mangrove ecosystem. The seventh, introducing the sustainable and legality assurance system. And what we already done also in engaging and investing the youth in the activity of our value net sink 2030. And next month, we will attend the COP29 in Baku, Azerbaijan, with the flag in solidarity for a green world. Hopefully, we can attend this meeting and give some presentation there and make some presentation in this meeting and about the successful of the Indonesia to maintain forestry and other land uses net sink 2030. That's all what I want to present to you. Thank you very much. I will send back to moderator. Thank you very much.
So thank you, Dr. Ruandha, for such an insightful presentation on the government's roles in tackling the climate change, including our plan, Indonesia plan for the carbon sink. So let's give, thank you also for the applause and also your discussion after this. But then we are fortunate to have 3 more distinguished speakers who will continue to expand this crucial topic. We will hear from Professor Kristie A.B. from the University of Washington. Then we will have Dr. Rebecca Patrick from the
I'm
Yes.
Kristie A.B. I'm going to talk with you for a few minutes about policy challenges and solutions for mitigating.
Yeah,
the health
so
risks of changing
this is the presentation from Professor Kristie A.B. from the University of Washington. Professor A.B. is globally recognized expert in climate change, but unfortunately, Professor A.B. couldn't join us in person, but she has kindly prepared the video that you have the spoiler before. Then please join me in welcoming her virtually as we play her presentation. So please welcome Professor A.B.
Hello, I'm Kristie A.B. I'm going to talk with you for a few minutes about policy challenges and solutions for mitigating the health risks of a changing climate. A good place to start for this discussion is the annual meeting last year of the Conference of the Parties of the United Nations Framework Convention on Climate Change. This meeting was held in Dubai in UEA. At that meeting was the first ever health day at one of these annual meetings. As you can see, there was a climate and health declaration put forward at that meeting that asked that countries put health at the heart of climate change. They also asked countries to accelerate the development of climate resilient, sustainable, and equitable health systems. Importantly, that declaration came with new financial commitments. Until that meeting, the total amount of funding for climate change and health under the adaptation funds was less than half of 1%. You can see large amounts of money was pledged. This does not mean it's actual money yet, but there are pledges of $1 billion to invest in climate change and health. And this will really change the landscape for the resilience of our health systems. At the same time, the World Health Organization issued its own declaration on climate and health. And you can see the main points of that declaration. The first is delivering on the Paris Agreement and accelerating the phase out of fossil fuels to safeguard our lives and the lives of our friends, our colleagues, our children, and future generations. The second is building climate resilient and low carbon health systems to make sure that, again, we protect current and future lives, health, and well-being. And finally, ask countries to deliver on promises made 15 years ago to deliver $100 billion annually in climate finance, and to spend this on saving lives and improving the health of the most vulnerable. This year, the World Health Assembly called upon member states to strengthen the implementation of WHO's global strategy on health, environment, and climate change. There's much that's been done, but there's a lot more that needs to be done. And I'll talk about a little bit of that in the next slides. Subejo recently developed an alliance for transformational action on climate and health. Countries are joining this and are working together to achieve the aims of the World Health Assembly and of the Climate and Health Declaration from the Conference of the Parties. You can see many of the points are echoed in the earlier documents on increasing investment, focusing on adaptation, but also focusing on research and development around climate change and health. WHO has a framework for promoting climate resilient health systems, which is shown on the right. A couple of important points from this is, one, you can see climate variability and change interact with the upstream drivers of exposure and vulnerability. It's very important to understand the extent of exposure of communities and regions, and to understand their underlying susceptibility and the capacity of the health systems to manage. Those interactions then affect the resilience of our health systems. Understanding these kinds of interactions means that in some instances, it's going to be more important to focus on decreasing susceptibility than it is on focusing on climate change. And so making sure that investments focus on where they will be most effective and most efficient. These interactions, as I said, affect the climate resilience of our health systems. You can see the different boxes on the diagram. These are different building blocks of our health systems. The big categories of adaptation are around service delivery and around health information systems. The more that our health systems are strengthened, the more that climate-sensitive health outcomes can be reduced, and our health facilities can manage the changes that are resulting from climate change. This emphasizes the point that climate-resilient health systems is not just focusing on the resilience of our health system, of our public health system, but also ensuring that our health facilities are sustainable and use low carbon energy. So WHO is focusing on both of these aspects to make sure that there is greater resilience and sustainability to a changing climate. WHO recognizes that countries are all in very different situations and put together this useful table showing different pathways. So the pathway and the area of focus is different for countries that have low performing health systems and low greenhouse gas emissions. In these cases, the primary focus is on adaptation. But if the countries have high performing systems and high greenhouse gas emissions, the focus needs to be on achieving net zero emissions while continuing to promote climate resilience. There's a number of categories in the middle, and it's trying to move all systems to high performance and low greenhouse gas emissions. Overall, when we look at emissions worldwide, about 5% of all emissions come from healthcare. So it's really important that healthcare reduces its greenhouse gas emissions to contribute to climate resilience. About every other year, although the last survey was in 2021, WHO surveys its member states. In the last survey, 95 countries responded. Of those, about half had a vulnerability and adaptation assessment. This is the first step in being prepared to adapt to a changing climate. Of those that had completed a vulnerability and adaptation assessment, only 18 reported that the findings strongly influenced their health policy, and only 9 felt they had the resources they needed for implementation. And this goes back to the points on the first slide about how important it is to increase investment in this area. At the same time as people are suffering and dying from climate change, then there's not the investment matching to make sure that countries have the human and financial resources they need to manage the risks of a changing climate. There's a long list of effective adaptation options. This is a summary from the Intergovernmental Panel on Climate Change chapter on human health. The number one option, of course, is strengthening the resilience of our health systems. I'll speak briefly about some of these points. If you'd like more information, there's a wealth of detail in that IPCC chapter, which is freely available to download. One of the key strategies being used in health and in other sectors is developing early warning and response systems, with the emphasis on the response, ensuring that it's not just telling people there's a likelihood of a disaster, but making sure people know what to do. The World Meteorological Organization, WMO, started an initiative in 2022 to develop climate risk and early warning systems to protect 111 million additional people. You can see there are some challenges with putting this together. In many cases, there are insufficient data, insufficient resources, but the demands are quite high. You can see that the damage caused by disasters could be reduced by 30% if an early warning is issued within 24 hours. There's other numbers here that give you a sense of the magnitude of the benefits of early warning systems. And I apologize, I misspoke, that this initiative by 2022 had already helped 111 million additional people. The goal is to help many more over the next 5 years. One of the initiatives that's under the World Meteorological Organization and the World Health Organization is the Global Heat Health Information Network, or GHIN. This is a screenshot from their main landing page showing you the places where there's projects, where work is ongoing to better understand how to better increase resilience to the warmer temperatures that we are all facing. Hundreds of places around the world have heat wave early warning and response systems. There's very effective ones in both high and middle income countries. This is an example from the UK. The UK has had a heat wave plan for many, many years. There are a number of iterations of this. Every year they review how well they did, they make modifications, and then they publish a new plan. And this shows on the slide the core elements of the plan, and shows that in the UK, they've got 4 heat wave alert levels in addition to long-term planning. Different regions decide on different numbers of alert levels. It depends on what already exists in terms of early warning systems, what the communities are used to, and finds ways then to integrate what is useful in the meteorological services with what is really important to happen in the health departments to make sure that people are protected as temperatures continue to rise. I'm not going to go through this, but it gives a sense of how this heat wave alert works. And importantly, the different kinds of groups that are involved. That there's local authorities who reach out to social services, schools, residential homes, nurseries and kindergarten, and thinking about all the different groups in society who are particularly vulnerable to higher temperature, and making sure that the early warning and response, as I keep emphasizing the response, then reaches out to these particularly vulnerable groups, finds ways to use trusted voices, to use various agencies to reach out so that people know not only is it going to be hot, but here's exactly what they can do. And if there's cooling shelters, how to find them, how to get to them, and thinking through the operational issues around heat wave early warning systems. So this could be one of several examples if people are interested they could look at to get some ideas of how to implement your own heat wave early warning systems locally. There's lots of actions that can be taken to reduce temperatures as we go into a warmer future. One is planting more trees. We know that trees cool down the urban environment. This is a study from Europe conducted by, I think it was IS Global. In Europe, there is a metric, there's a goal of increasing tree coverage to 30% per 100,000 inhabitants. And this modeling study looked at what if countries were able to achieve that, and shows the significant reduction in mortality if there is more tree cover. Other studies like this are coming out, and it's one of many examples of the kinds of adaptation options that could be implemented. This is just a reminder that when we think about climate change and health, at its core, climate change and health is an equity issue. This is from the United States, from the 5th National Climate Assessment, pointing out some of the factors that lead to inequities when we talk about heat and health. This information then can be used to better target interventions to ensure that the most vulnerable are protected during periods of very high temperatures. I've been talking about issues separately, but in fact, there is multiple changes going on with climate change. It's not just temperature, it's precipitation, which lead to a range of consequences that then affect other climate-sensitive health outcomes. On the right are just two examples in this cascade you see on the left. For example, extreme temperatures leading to drought, leading to crop failures and undernutrition, which then can lead to vulnerability and, in fact, even outbreaks of infectious diseases. The second one's on storms and floods, displacement, leading to outbreaks of dengue and leishmaniasis. So it's important when thinking about adapting to a changing climate that we take into account these kinds of interacting and cascading impacts to make sure that our health systems are as effective as they need to be. I wanted to spend a minute talking about mitigation. This is the most discouraging slide I have. It shows global fossil carbon dioxide emissions from 1990 with some major events that happened in the world, and you can see that very little made much difference in the trajectory of greenhouse gas emissions. Every year, the United Nations Environment Program puts out the emission gap report, and every year they have a figure such as this. This is the latest one that was published, and shows the gap between the goal, the Paris Agreement goal of trying to keep emissions such that warming will not go above 2 degrees and hopefully keeping it to 1.5. So the gap between the ambition and where we actually stand. And you can see it's a very large gap. This also can be done at the national level, and the pictures are fairly bleak. But in mitigation, there is a very important and positive health story to tell. And that is when you look at the major categories of mitigation, of various ways to reduce greenhouse gas emissions, that all of these have benefits for health. And if one calculates the number of avoided hospitalizations, the number of avoided premature deaths, and values those for different kinds of mitigation options, the answer is always the same, that the health benefits are of the same order of magnitude, if not larger, than the cost of doing the mitigation. This is a story that needs to be told strongly, repeatedly, and at all levels so that people understand we need to be mitigating for our health. The benefits will come sooner than they'll come for reducing climate change, and they will help the most vulnerable and make our societies more sustainable and more resilient. If you have not seen, there was an initiative that was published a few months back called the Pathfinder Initiative. It was looking at pathways to a net zero future. This initiative synthesized the evidence on the health co-benefits of climate mitigation with real-world examples of climate action and showing what those health benefits are. The initiative also has recommendations on ways forward to a healthy net zero future. There's a wealth of information. On the left are some of the mitigation options that were investigated. And on the right shows as one moves from those options to the benefits for health, you can see on the right that there's a whole range of benefits that are quite large. And the studies I mentioned had looked at different mitigation options separately, but as you combine them, you can start seeing even greater benefits for our health and for our well-being. The initiative has some recommendations for delivering a just and equitable transition, and this is a summary of some that were put into the report that was published, which is available at the Lancet. These are similar to the kinds of comments earlier that you saw from the various declarations at COP28, declarations from WHO, on ensuring universal access to clean, affordable, renewable energy, increasing green and blue spaces, making sure our transportation is accessible, it's safe and it's inclusive. Ideally, it's non-motor transport. The more people are on bikes and the more people walk and take buses, the healthier they are, and the lower the emissions. In many high-income countries, there's more emissions from transportation than there is from climate change. And finally, for agriculture, forestry, and land use, of making sure that rural workers are protected and that adaptation and mitigation actions are integrated so that they don't suffer during, for example, periods of high temperatures. With that, I hope I've given some hope that there are lots of positive approaches that can be taken to increase resilience. The challenges are quite large. This is a summary figure from the Intergovernmental Panel on Climate Change, pointing out there's a rapidly narrowing window of opportunity to enable climate resilience. That where we are today is far from resilient. And if we want to achieve a world that has low emissions, system transformations, low climate risk, equity and justice, and achieving the SDGs, paying attention to these development pathways and making sure at each of the inflection points, the choices are made to continue to move towards resilience and away from the kinds of conditions we have today where so many people are suffering from climate change. Thank you very much for listening. I really appreciate it, and I hope the rest of the conference goes well. Thank you.
Thank you, Professor Ibe. So we will proceed to our third speakers. Our third speaker is Dr. Rebecca Patrick from the University of Melbourne, Australia. Dr. Patrick research focus on the climate change, health, and community
Hello.
resilience.
A good place to start for this discussion. I'm going to talk with you for a few.
So good morning, Dr. Patrick. Yeah, today she will share the insight of the intersection of the climate policy and public health. Dr. Patrick, please note that she will be only with us until 10:30 Indonesian time. So if you have any question for her, we will open the floor for a brief Q&A immediately following her presentation instead of in the end of this, waiting for the end of this panel. So without further ado, please welcome Dr. Patrick.
Thank you so much. I'm absolutely delighted to be able to join you today. I understand it's a very large summer course, and it would be really appreciated at my end if your colleagues could share the slides now, starting with the first slide. Thank you. There's a little bit of feedback. I can deal with it. If it's not too bad at your end, just let me know. I can't see the slides at the moment. Are they up?
The slide is now visible here, but Dr. Patrick, yeah.
There must have been a pause.
Oh, yeah. Is it now visible to you, Dr. Patrick?
Yes, that's great. Thank you.
Okay, thanks.
All right. Again, I'd just like to share my appreciation for the opportunity to contribute to this summer course from an international perspective on solutions and future directions, with a focus in my session on mental health in our region. And of course, I'll be building on Professor Chris Eby's talk and appreciating the fact that we were very fortunate to have her in Australia, in Melbourne, where I come from, the University of Melbourne, with us for the last 2 weeks. She's headed home now as a distinguished professor, where she shared a lot of her knowledge and experience spanning more than 30 years in the field as a climate and health scientist, with my colleagues at the University of Melbourne, as well as policymakers and practitioners. So I'm delighted to build on her work. And my focus today will be on the state of the evidence, some of the pathways and mechanisms related to climate change and mental health, as well as some of the evidence from the region. But most importantly, I'll focus on showcasing some of the global and Australian level solutions and future directions. Next slide, please. Before I do, I just wanted to orient you to where I come from. I come from a group called the Climate Catch Lab, or Climate Collaborative Action for Transformative Change in Health and Healthcare, based at the University of Melbourne here in Australia. And this is a joint interdisciplinary initiative between the Population and Global Health School, the Medical School, as well as Melbourne Climate Futures. And our objective as a group of researchers, educators and practitioners is to accelerate the university's work on climate change and human health. So we do research, we do engagement and education. So that's where I hail from. Next slide. And just to acknowledge, our work spans from the left-hand side, health impacts, researching health impacts, including mental health, which I'm going to talk about today, sustainable healthcare, which is another area of expertise, policy and politics, just energy transitions, including some work happening in Southeast Asia, resilience, and always looking for opportunities to consider climate and health issues through innovative approaches to creativity and imagination. Next slide. All right, I understand you may already have a strong orientation on climate change and health links, but let me just take a few moments to pause and reflect on the specific relationships between the impacts of climate change on mental health outcomes. Next slide. Keep clicking through. There's 5 panels on this page. So here we have 5 summary points from the recent IPCC AR6, and they highlight where mental health has been identified. So the most recent IPCC AR6 report was the strongest yet in terms of the recognition of mental health and pulling together available evidence. On the top left-hand panel is the recognition that climate-related illnesses, deaths, malnutrition threats mental health and well-being, and there's a very high confidence of that. In the second panel there, in the top right, that there's new evidence and awareness of these impacts. That effective adaptation is going to be important in terms of protecting and promoting mental health in all regions of the world, that climate resilient development has potential to co-benefit mental health outcomes. And finally, but not least importantly, is that regional, local, Indigenous knowledge systems are really important to understanding vulnerability and capacity with regard to climate change. Next slide, please. So we understand that mental health is a cross-cutting issue arising from many of the primary, secondary and tertiary systematic effects of climate change. And we know that climate change is going to impact mental health across all of these pathways. These direct or primary impacts include exposure to traumatic events, such as bushfires, particularly in the Australian context, as well as of other severe weather-related climate events. So that's on the left-hand side there. Direct and indirect, the secondary and tertiary level, climate change threats mental health additively, interactively, and cumulatively, and that resonates with what Professor Kristie just presented. So there are several mental health related outcomes that have been associated with climate change in the literature. These range from psychological distress on the one hand, which is a part of normal human experiences, right through to severe and clinically significant mental health outcomes, which require specialist mental health care. Some of the most researched mental health outcomes are trauma-related disorders, which develop in response to the extreme weather events such as bushfires or flood, in particular PTSD or post-traumatic stress disorder. And this, as we know, is a chronic and disabling mental health outcome. We also know that mood disorders such as depression and anxiety disorders following a climate event or ongoing disruption to livelihoods become recognisable in our populations. And we also know that heat leads to people presenting in our emergency departments and hospitals with severe mental distress, suicidal ideation, as well as suicidal attempts. Next slide, please. For those visual learners amongst us, here's another way of representing the relationship between climate impacts, the pathways and mechanisms to mental health outcomes. And importantly, what this figure demonstrates is that mental health impacts are mediated and confounded by those physical health impacts of climate change, as well as disruption to social and community systems. And this is quite helpful visual diagram of those relationships and outcomes related to climate change. Next slide. So in terms of the lived experience, and when we see these forms of psychological distress or mental health related outcomes, this can conceptualise as being before anticipation of a climate related event, and what manifests there are things like anxiety. A new phenomena, not new, new to the field of climate change research, but already established in psychological research, is anticipatory trauma and grief. Anticipatory trauma has been documented with regard to soldiers heading into war zones, and the anticipatory trauma that goes with heading into an extremely difficult situation. Then during a climate-related event, we see stress, panic and other heightened mental psychological states. And then, of course, after, which is cultural displacement, PTSD, depression and other outcomes related to the impacts of climate change. Next slide, please. But let's just take a pause for a moment and look at the foundational ideas and why and how human health and well-being, particularly psychological well-being, actually depends on nature and healthy ecosystems, and therefore why this link between climate change and mental health is so important in our considerations in terms of promoting climate resilience, adaptation and mitigation. We know that from the biophilia hypothesis that humans are hardwired to have nature connections. It's really important for our psychosocial well-being. And if you look to the left of this diagram, we know that having time in and around nature, such as walking nature, reviewing nature, and quality park space, create the active ingredients such as environmental biodiversity and reduce heat and reduce violence, which promotes psychological and physiological states of relaxation or vitality and attention restoration, as well as sleep and social ties, which then promotes the health outcomes of things like reduced anxiety disorders and other mental health outcomes, as you can see here. So we know it's two sides of the same situation, that humans need nature connections for health and well-being. Unfortunately, climate change and environmental degradation is disrupting these pathways, and so we're seeing the increase of mental health related outcomes. All right, let's now move swiftly onto the next slide and start to, next slide please, and start to think about this link between climate and mental health in our own region. So I just want to draw your attention to some of the most recent thinking on climate and mental health. Some of you may have participated in a regional dialogue that was in your region recently, the Eastern and Southeastern Asian region. I know that there were participants from the Indonesian context in a project called Connecting Climate Minds. And Connecting Climate Minds bring the literature together with experts from across your region to understand what the risks are to mental health from climate change in your region, very specific to your region, what the pathways and mechanisms, and what research and evidence is required to move forward. So I'm highlighting this for two reasons: to draw your attention to this important field of work that has been undertaken in your region. Next slide. And so in the Eastern and Southeastern region, we know that extreme temperatures are impacting mental health. We know that droughts, but to some extent a low level of confidence there, are impacting you in the region. Heavy precipitation in particular, there's high level of confidence that there is a link between that and mental health. We know that flooding and sea level rise are also, with a high level of confidence, impacting mental health outcomes as it relates to climate change impacts. Within this report, and on the next slide, we highlight some of these pathways and mechanisms. On the next slide, please. Thank you. We know that repeated experiences of climate change increase susceptibility to PTSD and anxiety. We know that gender inequities and increasing violence, including family violence, is related to climate change and depression and anxiety. We know that in your region there is concern amongst experts that schools that are converted into evacuation centres, which are important in disasters, is inadvertently disrupting education amongst school children. And just acknowledging the amount of time I have, you can follow up with further information on these pathways and mechanisms in that report. Now, I'm going to bring you a little bit closer to my home, but I'd like to say it's still in the region. On the next slide, please, is where I hail from and where I have done most of my work considering this link between climate change and mental health, as well as the solutions and opportunities. So Australia, as you can see down in the bottom right-hand corner, is situated in Oceania, and we're very close to where you are. And we do indeed share some of the risks and exposures of Southeast Asia, noteworthy being heat, as well as some of the precipitation events that's happening in the Pacific and northern parts of Australia. We also know in the Oceania context that First Nations people both are quite vulnerable to the impacts of climate change, but also have instigated many adaptation responses, and we have a lot to learn from our Indigenous knowledges and peoples in the region that needs to be incorporated into policy and solution work. Next slide, please. My research in particular has included a national survey on the prevalence and determinants of mental health related to climate change in Australia. We found in this nationally representative survey that Australians were more concerned about climate change than COVID, and that was right at the start of COVID, that survey, so that is quite significant. And we know that in the Australian context, climate change was one of the biggest concerns about climate change, was one of the biggest influences on the change of government in Australia. Australians report that most Australians report they have a direct experience of a climate change related event. Young people are particularly experiencing significant rates of the eco-anxiety or high levels of distress about climate change. And 1 in 4 people that have experienced a climate change event met the criteria for post-traumatic stress disorder. And to that anticipatory trauma or pre-trauma, we're seeing that particularly in younger age groups and women. But on the flip side, we know that, sorry, not the next slide, previous slide, we also measured coping, and we know that Australians aren't really seeking traditional mental health care, but rather prescribing their own solutions, including viewing the many natural wonders and environments that we have in Australia and becoming informed and taking action on climate change. Next slide. Now, this is quite difficult to deconstruct, but the point I want to make here is that we have done extensive research consulting with young people, practitioners, and policymakers about what drives mental health related outcomes amongst young Australians. And importantly, if we just focus on the individual level, we miss this very complex picture of the drivers of mental health outcomes as it relates to climate change. For example, young people that have direct experience of climate change in Australia often feel powerless and have fear of the future. Australians are also worried about government inaction on climate change. So it's a very complex picture demonstrating that the social determinants, commercial determinants, and other determinants of health are all in the mix when understanding these complex situations as they rise. Next slide. And importantly, we identify that young people's voices are important in solutions and future directions. And many young people are very keen to be a part of the generation that brings about the positive change. All right, next slide, and moving swiftly on to solutions and directions, which is very much the important topic that you're considering today and throughout this panel. Going to the next slide, I want to draw your attention to the World Health Organization's Mental Health and Climate Change Policy Brief. Within that globally applicable brief, they've identified 5 key approaches to address the impacts of climate change on mental health. The importance of integrating climate change considerations into policy and programs, mental health, including mental health and psychosocial support, obviously to prepare for and respond to the climate crisis. Integrating, and equally in the opposite direction, mental health and psychosocial support, which is abbreviated MHPSS within policies and programs within climate change and health. We need to certainly build upon those global commitments such as the SDGs and Paris commitments and link mental health to that. We need to certainly implement multi-sectoral and community-based approaches to reduce those vulnerabilities and build capacity. And of course, there's large gaps that exist in funding mental health outcomes, as well as responding to climate change. And so climate financing and the commitments that Chris Oyibai pointed out are an area that we need to tap into to ensure that we can promote mental health. On the next slide are just some very brief excerpts. It might be quite difficult for you to see, but I just want to draw your attention to the important issues of leadership and governance as articulated by the WHO in this particular policy brief. That we need to integrate these considerations of climate and mental health into adaptation and mitigation efforts. And of course, to the point around mobilising community, in particular young people, we need community mobilisation with regards to these actions. In our health and national adaptation plans, I know that Indonesia has several health determining sector policies for climate change adaptation. I had an MPH student recently doing some work analysing your policy context. And so there's certainly some opportunities to integrate considerations of mental health within Indonesian climate adaptation initiatives. Next slide, please. Vulnerability, capacity and adaptation assessments, the important ingredients that fits under a HNAP or Health National Adaptation Plan. There's opportunities there for incorporating indicators and baselines for assessing mental health impacts. I know that there is some work underway in terms of VCAs, vulnerability, capacity and adaptation assessments in the region, and Southeast Asia does actually boast some really great work in terms of the VCAs that underpin a Health National Adaptation Plan. Importantly, we need to build capacity of our health workforce, not only of health professionals, but those other allied health professional roles to have mental health literacy, to be able to be a resource for supporting mental health in our communities that are impacted by climate-related events, which I pointed out above. Next slide, please. Now, here's a nice case study also drawn from that WHO policy brief, which is from a country not far from all of us, which is in India. And this is a nice example of where a collaboration between the UN and India's own National Institute of Mental Health and Neurosciences teamed up to focus on disaster risk reduction and integrating mental health and psychological support, and have built out a number of resources for preparedness and capacity building. So a really nice example of where the WHO priority areas for future directions and solutions have come together there. I really recommend having a look at that policy brief and downloading it. Now, to finish off, I just want to bring you from global to my local scale again. So if you could just pop to the next slide. And I'd just like to briefly showcase some of the work that's happening in my own backyard and what the Australian health sector is doing in terms of hope and coping in a climate impacted Australia. What we have here are medical and health professionals participating in climate advocacy in the Australian context. And there's some excellent work happening from our psychologists, psychiatrists, and other mental health professionals with regard to training up health professionals with the mental health literacy, as well as climate literacy, to understand the issues that I've briefly covered at the start of this presentation. And to ensure that health professionals have the basic competencies to understand the links between climate change and mental health, as well as be prepared and able to respond. Next slide, please. In terms of policy, on the left-hand side, I've been involved in an organisation called the Climate and Health Alliance, which is an alliance of health organisations and individual health professionals right across Australia. And over a period of more than 10 years, we developed a framework for promoting healthy, regenerative and just framework for a national strategy, which I'm very delighted to say on the right-hand side actually led to the development of Australia's first national health and climate strategy. The consultative work that we did leading up to that national strategy led it to the identification of the importance of mental health considerations in any national strategy, including service provision, nature-based solutions, as well as investing in community mental health programs, including resilience workshops and counselling services. And much of this consultative and evidence-based work has fed forward into our national strategy. Just one or two slides left. Next slide, please. What are some of the health interventions, mental health interventions that have taken place? On the far left, the left-hand corner, Australian Psychological Society has put together a climate change empowerment handbook to guide practitioners as well as parents in mental health and psychological responses. Psychology for a Safe Climate has been established, and they're doing a lot of work building capacity of our mental health workforce. There's been a number of policy briefs established, as well as webinars supporting the capacity building of our sector. Next slide, please. And importantly, and linked back to the value of co-benefits approach, there's also a number of interventions that have evolved at national and subnational scale in the Australian context, which is around nature-based solutions and place-based solutions. So supporting people in a preventative and health promotion approach to get back into nature, to care for nature and protect nature, which has flow-on effects for climate mitigation and adaptation. Last slide, please. And importantly, at the end of all of my presentations, I draw my attention and your attention back to our own hope and coping. When we talk about climate change and the health impacts of climate change, there is a lot to digest. There's some very powerful science that can fill us with concerns. We know that taking action, taking time out for ourselves, balancing action with our own personal reflection and working together is a really important antidote to some of these concerns when we immerse ourselves in climate change considerations. And I do encourage that you consider your own mental health today and think about what you are going to do to protect your own health and well-being as someone that is learning about and considering the impacts of climate change on health. Thank you very much, and I hope that has helped you with your understanding.
Thank you. Thank you, Dr. Patrick, for the insightful speech on the relationship between mental health and climate change. It's also bring us the underscoring the need to address this issue together. Now we invite the participants to engage in discussion. We have Dr. Patrick. We also have Dr. Ruandha on this session. If anyone would like to have the discussion. Anyone would like to have the discussion? Yeah? Yeah? Please, the microphone.
Thank you very much for your speech. I have a question regarding the first topic that we
Dr.
were
Ruandha?
talking about.
Okay.
Yeah. If I'm not wrong, you mentioned that you were involved in climate change policies. I'm a master's student in humanitarian action. And in your experience, how was the involvement with the international donors and funds? That's it. Thank you.
Would you like to introduce yourself first so that we can address you more in a proper way? Yeah.
Yeah.
Name and also institution.
Yes, sorry. I'm Alejandra. I'm part of NOHA program. It is a master in international humanitarian action in Germany. Thank
Okay.
you.
Yeah, Dr. Ruandha, would you like to address?
Yeah. Thank you, Alejandra, for your question. Yes. To involve the international funding support. Yeah. First, we already has in the community is UN-led activities. So the support from World Bank. And this is our project, the first project in Indonesia about the climate change, and the secondly about the result-based payment. So Indonesia has a report to the international, and then the country who want to give that incentive see our report, and then they make a verification for this country. For Indonesian case is Norwegia, and then Norwegia give this report to another verificator. So then verificator said that, okay, the report of Indonesia is valid, and then Norway gives some funding to Indonesia. So we have already 3 times about the funding from Norwegia. And also we can get also from the Green Climate Funds. So our report to the international, and then we submit to the Green Climate Fund to assess our report. For example, here 2017 until 2019, how many emission we can reduce, and then they can calculate from that one, and then they will give some funding support from the GCF Green Climate Funds. So yeah, thank you. Yeah.
So yeah, thank you, Dr. Ruandha, for your answer. So I hope it's. Do you have any other concerns or any other discussion? Okay, following it. Okay, so any other discussion from the floor? Oh, there's no discussion. So maybe we also can just go for a coffee break after this, and we'll just we'll have our 4th speakers and other. We also will have the Q&A. Resen? In Zoom? Okay. Yes, please.
Hello, yeah. If I have a question, yeah. So my question is also to Dr. Ruandha. It might be a bit controversial, so I'm sorry for that, but I just want to ask you, being from the government. First of all, I really commend and appreciate the efforts your government is taking. But then there are 2 issues these days. One is the shifting of the new capital to Kalimantan. So there are like the environmental activists. They are raising this issue of deforestation and the environmental impact of the new capital in Kalimantan. And the others in Papua, again, people are really against the idea, because I see in social media and all, the activists, they are really against, the Trans-Papua Highway and the deforestation that's going on there. So what's the truth to that? And there are those issues. How is the government dealing with it? Thank you very much. Yeah.
Okay, so would you like to introduce yourself first?
Oh, sorry. I am Noman, and I'm a master student in biomedical sciences at University of Indonesia.
Okay, thank you. It's a very challenging question about the new capital in East Kalimantan and food estate in Papua. Yes, Actually, when we designed the new capital in East Kalimantan, in Penajam area, we have already has we call it KLHS, Kajian Strategis Lingkungan Hidup apa Pak itu Pak? Yeah. How we can make a assessment, environmental assessment at the very beginning. And you know this now the forest cover of this area right now is at only 24%. And President Jokowi asked to the new capital, we will make the forest cover is become 65 or until 75%. So that's why in that area we also build or develop the modern nursery. So the production is about 15 million seedling every year with the endemic species to make new forest in this area. So don't worry, we will convert the area that already built in the East Kalimantan for the new capital will be forested in the near future. We have already activity there, and then the nursery is already done there, and also we have some activity. For example, the Wanagama Nusantara. We replicate the Wanagama in Yogyakarta, bring it to the IKN in East Kalimantan. And about the food estate, yes, because this one will become the quick win of this president, the food security. So we open this area for the to make the area for the food security. So this is also we at the very beginning we already have a study of the environmental assessment of the area. So we very careful and prudently to open this area, so to make some food estate in Papua. This is my answer. Thank you very much. Yeah.
Yeah, thank you, Dr. Ruandha. Any other question before we'll proceed to the coffee break? We don't have any other question also in Zoom, yeah? It's only, yeah. Okay, so yeah, this is the end of the first session of this panel. So after this, we will have the coffee break. Then we'll go back here to have our fourth speaker, Professor Subejo, that is also already with us. Thank you, Professor Subejo, for your time here. And we will have the speech from Professor Subejo at 9:50. So now, please, if you want to grab the coffee break is in front of our floor.
Before close, there is a gift for the who is have a question for.
Oh yeah, yes, so Dr. Ruandha has.
Alexandra is a gift for you.
Alexandra.
Yeah. And the other person.
The other. So the other from the Zoom was from UI. So. Yeah. If you have any means to go to Yogyakarta, please, we have the gift. So we would like to have Dr. Ruandha giving the gift to, For those who would like also to have the gift, we will have the second Q&A session. So after the fourth speaker, so I hope that it will give, you will have also the gift then. Thanks, Alexandra. So yeah, so three more key from Dr. Ruandha. If you have any question or comment or discussion for Dr. Ruandha after the fourth speaker in the Q&A session. So without further ado, so please have the coffee break and let's get back for the discussion at 9:50. So thank you.
Het is ook nog eens een goeie. Mag er nog in?
Iya. Ada satu. Mungkin karena waktunya kadang-kadang. Jadi samar. Ya, ya. Hello. So, yeah, I hope that you all have the nice coffee break. We have banana chips. Yeah, it's maybe quite strange for you, but that's the things that we have for snack. We will begin the session shortly. Okay, so for our fourth speaker, we have Professor Subejo from Universitas Gadjah Mada. Professor Subejo is a professor of agricultural socioeconomics in Faculty of Agriculture, Universitas Gadjah Mada. He will present on agricultural society innovation in the response to climate change, highlighting the innovative strategies of community that adapt to climate shift in agriculture. So please welcome Prof. Subejo.
30 minutes. Okay, thank you, moderators. Good morning, everybody. Good morning. Yeah, hopefully after having a snack, maybe enough energy for us for having some discussion. Yeah, actually, my background is not health science, but agriculture. So, agriculture, yeah, of course, agriculture also to some extent related to health issues. And I suppose the climate change impacts, double impact for the health science, indirect and direct, because climate change impact to productivity of the food and food consumed by the people. And then the second is direct impact to health status. So I think we will discuss maybe majority on the issue of the food productivity, food provision, and food maybe to some extent also food consumption. Yeah. Yeah, I will give very rough information about the status of global food system. Yeah, maybe some issue will be raised in this aspect. Yeah. maybe as we know, we are facing very problematic, big problems. Firstly, as I already mentioned, we will have a great impact, negative impact on food productivity, food production, and then also the, yeah, of course, I checked in the newspaper that currently the number of population in the world already 8.2 billion, big number, and we should provide enough food for all of the people in the world. In case of Indonesia, we already reached 281 people. So this is big burden. So we should produce enough food for all of these people. And then in the middle, of course, climate change. Due to the climate change, even in Indonesia, actually, this month already rainy season, we start to planting. But in fact, we still should wait maybe another 1 or 2 months, and maybe such as in case last year, the postpone of the starting time of the planting season 2 months, and this is also a big problem. Actually, we can produce 3 times a year. Due to the impact of climate change, due to the El Nino and La Nina, we only could produce 2 times a year. So it's mean the number of food produced also significantly decreasing. And then the third, we produce of food not only for the people, but actually we produce food for 4 aspects. We call as 4F. Yeah. For food, for feed, for fuel, and for fiber. We produce corn in the US, not for the people directly, but for the livestock, for the fish. Of course, livestock and fish consumed by the people. And then we produce the food also for fuels. In US, in Brazil, in some places, we produce sugarcane not for people, but for the fuel, pure fuel. So it means that great competition in the future will be high and high, because one product but be used for multiple purposes. So it's mean the demand of a direct food of the people also will get problematic in the future, because the great competition in use of the commodity. And then due to the strategic of the food, currently many countries, many multinational company pay high attention how to produce enough food. So we call globally as the land acquisition, because many country, many corporations want to acquisition a huge number of land and producing food, including, of course, later on I will show you some investor try, including Singapore. Singapore, small country, and then having no land, and then better to invest huge money in Africa and Indonesia to produce enough food, and then in case of the food problem, and then they can get access on food, India, China, because they have a huge number of the people. So by investing huge number of investment in Africa, in some Asian countries, so they can have access on food supply. This I get data from one papers that Indonesia one among the target of the Ruandha. Indonesia among one and the largest target for the land acquisition, over 3 million hectares. And then the investor, United States, Malaysia, Arab Emirates, UK, and so on, including, of course, the Singapore, because anyone come from Singapore? Yeah, very interesting in case of Singapore. For many years, Singapore always number 1 in food security rank, always number 1, because having money. Due to having money, Singapore can buy anything from the world. But during the pandemic COVID-19, no country selling the product in the international market. So the rank of Singapore dropping from number 1 into number 15. It means we should have capability in producing the food, including not only Indonesia, but also Singapore and then Arabian countries and so on. So this is very interesting. And then, yeah, this is very interesting data. Of course, Pak Ruandha maybe can explain more detail. We have, the tendency, the increasing of the event of disaster in Indonesia, also the impact of the economic losses. Yeah, we can see from the health aspect, and then also fisheries and agriculture. Agriculture also, the data show the increasing trend of the economic loss due to the climate change, due to the disaster. And then I will skip this part. Of course, this is the common understanding that we have introduced about the adaptation strategy and mitigation strategy. Later on, maybe we can discuss in more detail. Yeah, this is about the policy. I think Indonesian government also maybe before Dr. Wanda already mentioned about the budget allocation for the coping about the climate change and so on. Also the yearly. Yeah, this is a very interesting data. Actually, not really the newest one, but at least data in 2023. We can see, yeah, before, yeah, Singapore always number one, even before, always number one in global food security. But during the pandemic, the ranks significantly dropped. Of course, Indonesia has also dropped. Why? Yeah, because every country want to try to secure the need of the people, so better to keep the food rather to sell in the global market. So even we have money, if in the global market there is no food, so we cannot access the food. So this is an interesting strategy. And due to this situation, so currently many countries, many international corporations trying to investing huge number of investment for producing not only crops but also in fisheries, also in the some product including the livestock, because food not only come from the crops but also from the livestock, also from the fisheries product. Yeah. In case of Indonesia, we have actually three session. Yeah, we call as dry season. And then actually starting from rainy season, dry season 1, dry season 2, in the best situation we can produce 3 times a year. But in some places actually we can only produce 2 times or even only 1 time for the, yeah. Of course, we are facing many problems. For the dry season, usually we are facing the droughts, many cases of the failure of the planting, and then also flooding, and then for the dry season 1, water shortage. In some places also some planting crops and then failure due to there is no water. This is also the issue how we should cope with this situation. Yeah, this is some picture. Can in order to you imagine maybe the situation in Indonesia, we have a huge variety of the farming practices. The best practices in this one very flat. Yeah, oh, sorry. Very flat, and then we are also having the terrace farming, including in Bali. If you visited Bali, you can see the terrace farming in Bali, in Ubud, and so on. And then even we also produce some crops in very, yeah, actually this is the highly, yeah, very complicated, and we are usually using terrace. Like this one is this one is. Jumping, I'm not sure. Wait a moment, yeah. Oh, wait a moment, yes. Maybe this one, yeah. I will skip some part, but I'm not sure. Maybe some. Oh, wait a moment. Yeah, sorry. I should show you some issue, huge variety, and then in some places favorable resources, but in some places also unfavorable. So sorry, I'm not sure how to back the slide. Oh yes, okay. Yeah. Even in coastal area, actually we can produce some crops, but the condition also very dry, so we should modify with some watering system and so on, but very technical. And then this is the study about the impact of climate change. Yeah, of course in Java is the main producer of the food. 50% of the rice produced in this island in Java. Actually not so big, but due to the good infrastructure and soil fertility, so 50% of rice produced in this island. But the challenge also very big due to the land conversion. currently huge number of land converting into housing, converting into the industry and so on. And then there are the problems. For producing the agricultural crop, we need water. In some places, the surface water is enough, but in some places, we should use the well pumps, the depth of well pumps, sometimes to 40, 60 meter dips. And then in the long runs, actually, will be problematic. Maybe for the short run, it's okay. We can get the water very easy. But for the long runs, maybe this problem, maybe we cannot get the water anymore because the groundwater is used up. And this is the situation. I visit some places in East Java, especially. In Java, in some district, maybe they use over 20 pumps. We can imagine. So maybe the deep water shortly will be used up. So of course, in the future, we face a very tough situation in getting the water. And then this is the situation of I think the case of Indonesia. Actually, of course, the front line is the extension staff. Usually farmers guided by extension staff, and extension staff also trains in the issue of the climate change, but the number very limited. And then university also involved. So we can see in these parts the relationship between extension staff and then local farmers, and also in Indonesia actually we already the climate field school. This is arranged by Ministry of Agriculture and Agency on the climatology. So these two institutions actually introducing the farmers in preparation to face the climate change, but the numbers still very limited. Actually, in the beginning, supported by FAO. So in the future, maybe we should support. So local government and central government should expand this type of the fit school, especially in coping the climate change. And then I will raise some issue. I don't know about the situation in the other country, but at least in Indonesia, agriculture, labor getting older and older. We can see, especially in the food crops, the number of farmers over 80 years, 60 years, this is the largest. But for the horticulture and the plantation, I think it's okay. But in case of the food crops, I think this is our challenge in the future, because we consume directly food crops, but the farmers producing food crops aging. And then also about the education. We can see from this figure, usually only elementary school, even no school. You can imagine, it's people and no school, and how we can improve the productivity. This is our challenge in terms of the human resources for providing enough agricultural product. And then discussing about human resources, not only farmers, but also about the extension staff, how to guide the farmers. The number of extension staff also not enough. The number of villages in Indonesia, 81,000, but number of extension staff only 72,000. So we still need addition of 10,000 of the farmer guiding farmers by the extension staff. And then it is some picture documenting about the climate fit school. Usually they observe in the field and then documenting in some paper, and then discuss about how to cope about the water status, and then about the pest attack and so on. So this is a kind of the activities of the farmer fit school, especially on the climate change. Yeah, of course, some strategy already introduced. For example, for expanding the cultivating farming land, and then also selecting the irrigation system, and then selecting the high yield varieties, also using particular fertilizer, technical improvement, and so on. Yeah, I wrote one article in Tempo about the strategy of farmers in coping with the climate change, but still we cannot solve properly about this issue. some strategy should be introduced not only by government but including the universities, because university having some researcher and then maybe student also could have community services and then guiding the farmer how to cope about this issue. Commitment of the finance and then training, strengthening the role of universities, and then the speed flexibility on assessing the climate change, and then also collaboration. We should collaborate private sector, governments, universities, and then also community. And in UGM, we already start from last 10 years, we introducing one application we call as S.Si. S.Si is a digitalized extension system application. We try to combine between the teacher, extension worker, and farmers, and then exchanging the idea. And then currently the member of this application already 20,000 people, whole of Indonesia. And hopefully using this kind of application, we can also cope with to some extent the issue on climate change, because one of the menu is about the climate. So hopefully using this application, clearing farmers could access and then could discuss or exchange the idea how to cope the issue on the impact of climate change. And then actually in terms of the digitalization, we can see from this figure the number of mobile phone, the number of people accessing the internet already big enough in Indonesia. The number of people using social media already close to 200 million. Indonesian population is 281 million. And then the number of people of accessing internet already 200 millions. I think this is the good opportunity how to use this new media in circulating the strategy, in circulating the information, in coping the climate change in the future. And then, yeah, of course, in terms of funding, actually starting from 2015, Indonesian government giving beach money to village. Every village 1 year getting 1 billion Indonesian rupiah. I don't know in dollars, but for Indonesian this is big money and can be used for the purposes of the village. So I do hope that the village policy can use this part of the money how to cope about the food security, how to cope the impact of climate change in rural area. So this is quite promising. This is direct transfer from central government to the village. And in total, last year maybe 68 trillion Indonesian rupiah, very big money. And of course, due to the problem is more problematic in the future, we should combine not only producing the food crop, but we also should produce the livestock, should produce the fish, and also processing. So it means also diversifying the product, diversifying the income for the farming household. And then if we only rely on the raw material, I think the economic value is very small. So for farming household in the future, maybe we should propose we call as the experience economic. How to sell the product, not only product itself, but the situation, the experience. For example, in cafe, we can enjoy staying in the rural area 1 day, 1 night, and then picking the cafe, processing, enjoying in the morning, and then maybe we can charge maybe equal to 100 kilogram of the cafe. We call this is as experience economic. And agriculture is quite promising, because we can offer so many activities and related activities on agriculture, so inviting people, not only foreigners, but even Indonesian, maybe from the big city, big towns, come to the village, and then also students and so on. So this is actually quite promising in order to maintain the income of the people in rural area. And then this is situation in coastal area. Actually, people in coastal area also starting to use the land. We can call it the marginal farming lands, and then growing some vegetables, and then using the watering system, and then using the manures, and finally they can produce some product. So this is actually also quite promising for adding the product of agriculture in the future, especially in case of Indonesia. Also eastern part of Indonesia in Merauke. I visited several times. They can produce sweet potato. We do hope maybe in the future this is the center of the food in Indonesia, not rice, but maybe sweet potato and some tuber crops. For rice, maybe not so simple because the soil suitability and then the water system is not so easy in this part. Yeah, this is still in. This is a combination of crops and fish. We can produce crop and fish, and then also young farmers. Yeah, even the issue on gender also very important in agriculture. How to provide the opportunity to the ladies, and then these young ladies also involving in producing the papaya, Californian papaya, very short and not so difficult to handle in this production. So actually we have many opportunity, many chance to provide agriculture production system. And then this is the auction market. Usually the farmer facing the difficulties in selling the product, but by introducing the innovation on the governance, especially the auction market, this is quite useful. The product collected in one places and then farmer inviting the buyer and the price getting higher and higher. So there is no direct transaction between farmers and trader, but usually in group. So the bargaining position of the farmers is getting stronger and stronger. Yeah, this area is in Hali area, starting to produce not only cassava, even the salad. Yeah, very interesting. Yeah, I will farmers introducing some strategy how to cope about the scarcity of the water. Actually, in the beginning, they start just only simple ponds for conserving the waters and be used in the dry season, and then they secondly build using the cement, but very expensive. And the current situation, they try to introduce with the geomembrane, very simple, yes, but for farmers still expensive, but very simple. And then can be used for storing the water and be used for the dry season. So I think this is also the good strategy how to cope with the scarcity of the water, especially in the Hali area. And then actually government introducing the electricity, yeah, electricity and agriculture. For the short term, I think it's okay. Yeah, they can get water, but in the long terms, due to a big number of farmers using the deep water pumps, using the electricity, I think also will be problematic. Maybe in the groundwater also will be used up. So I think this is not sustained a type of the watering system for agriculture. We actually try to collaborate with Ministry of Public Works and local governments in Gunung Kidul, but still in the planning, we try to introduce the system of connecting the water collectors. For example, in the top we built the I'm not sure. Okay. Yeah, usually in the top we build the big water storage, and then using the pipe we can use the gratification, and then maybe no need to electricity, and hopefully using this system, the farmer can get the cheap water, even maybe no payment due to using there is no electricity, only investment in the beginning for the construction. And actually the Ministry of Public Works already agree with this system, but so far we still negotiating about the how to construct, because we should provide the enough land for constructing the big pond like small dam, and then the connectors, and then this area actually 70 hectares of the shallot, and usually they only grow 2 times. Hopefully by using this strategy we can grow 4 times or even 5 times a year. It's mean also getting more income of the farmers, also the more sustain in using the water and so on. So yeah, we still trying to realize this strategy in collaboration with central government and local government. And maybe just last slide. Yeah, last slide. Impossible for us as a single player on development, but we should collaborate with many parties, not only central governments, but we should collaborate in case of in highly area of eastern part of Jogja. We collaborate with the local governments and then state-owned company for providing fertilizer, Ministry of Agriculture, and then Indonesian Central Bank, also National Land Agency, and also university. Of course, the community. So, of course, in the success of agriculture development, food sector should involve more parties. I think this is the last slides. Yeah, this one is UGM also introducing the one variety of the rice which can adapt in the flood situation and dry situation. We call as a gamagura, or we can call as amphibi rice. I think this is quite promising. The productivity is relatively high, and this is aromatic rice. So maybe yesterday we introduced to the Ministry of Agriculture, hopefully can be adopted in solving the problem of the water availability, water scarcity, and we do hope, and then the productivity also still high, 7 to 10 tons per hectare. I think that's all, and then we can have some discussion. Maybe we still have time for discussion. Thank you very much.
Thank you, Professor Subejo. Yeah, so dear participants, so now we are in the last Q&A session, the second Q&A session. We still have Dr. Ruandha and also Professor Subejo here with us. So if you have any question to Dr. Ruandha and also Prof. Subejo, please. Yes. Is it? Is Yopi? Yeah.
Okay, yeah. Thank you. Thank you, Dr. Ruandha and Professor Subejo. The original staple food in Eastern Indonesia is not rice. Rice is become common due to Berasization program. So I'm very happy to hear about the promising future of sweet potatoes you explained earlier. I'm querying about why isn't this idea applied nationally? Are there any consumer-driven policy initiative that focus on educating the public about the environmental impact of the food source and food processing choices? Because consumers is vastly outnumber the producent, and changing consumer habits regarding food choices can significantly impact the food chains. Thank you.
Yeah, thank you for your question and discussion. But would you like to introduce yourself, name and also institution? Yeah.
I am Yurika, currently studying medical education here at Gadjah. Yeah.
Okay. Yeah. So I guess that question was for Prof. Subejo. Oh, both also? Yeah. So Prof. Subejo? Yeah.
Okay, direct answer. Okay. Thank you, Yurika. Yeah, I think very good question. Yes, actually we have a huge number of the source product, including sago. In eastern part of Indonesia, we produce huge number of sago, but so far still we use very limited type of the food. Currently, actually, we can introduce a kind of the, we call as the, not artificial rice, we call as the analog rice. Rice, but made from not paddy, made from sago, made from cassava, made from corn. The problem is, yes, you already mentioned the behavior in consumption, in changing, because they usually consume the paddy rice, and currently if we introduce the sago rice, but actually the people from the biotechnology, I think could, getting strategy how to make maybe the colors and then the taste and so on close to the taste of the paddy rice. This is the challenge for the people from the biotechnology, people from the manufacturer. But in terms of the material, I think enough. In eastern part of Indonesia, we can produce the cassava, we can produce sago, and this is also relatively easy to be cultivated as compared to the rice. Need very small number of water as compared to the rice, because when producing the rice we need a huge number of water. So The problem is how to promote for the national industry in producing this kind of the food. We can call as the Japan might be importing the rice made by, we can call in eastern part of Indonesia, perhutani producing the porang. Yeah, we call, I don't know in English, but kind of the tabar produced mixed with the forest product. In Japan, sometimes the branding is shiratake rice. Actually, this is not paddy rice, but this is some kind of tabar we call porang in Indonesia. And then high quality, even the price might be 10 times as compared to the paddy rice. So quite promising actually. So this is the problem of industry, food processing industry. In terms of the material is okay. We have enough material. Yeah. Yes, I think also education. After producing this stuff, we should also educate the people. But changing the behavior of the people actually also not so easy. But yeah, you should try because the paddy rice is very difficult to produce and then very challenging. But producing the sagu rice, I think more easy, and then also like the shiratake, not so difficult, but the price also get better. Yeah. Yeah. Consumer education, I think, very important also. Yeah.
Thanks. Thanks, Professor. So, would you like to have the follow-up discussion, or we should go to Dr. Ruandha for? So Dr. Ruandha. Food estate. Food industry.
Yes, as the Mr. President said that he has a program for 4 to 5 years. Indonesia will achieve the food security. I think it's not only the production, of course, also the industry, processing also will consider on that target. So in food acid in the Merauke, it's the question from online. Yeah. Yes. We not only produce for Indonesia for the food security, national food security, but we also plan to have export from Indonesia. So the Papua New Guinea is already asked for that product from Merauke. So, and even Mr. President said Indonesia target to be food barn, lumbung padi international. Yeah. Yes, this is my answer. Thank you.
Thank you, Dr. Ruandha. So, any follow-up discussion?
Yes, thank you. Dr. Ruandha. Why we have to open old forest for new agricultural land, and then we have another land to reforestation? Why? Because I think the old forest is very high in biodiversity. Why don't we exchange that? We keep this old forest and the land that we want to reforestation used to agricultural crops.
Yes, yes, this is a very good question. So when another ministry, agriculture ministry or the Menteri Pertahanan asks for the land for the food, we make some study, environmental study for that. So the land that already available is the area is a very not so wide area. So they need for the very high big area. So the Merauke is one of these possibility. Actually, they asked for 2 million hectares, but Ministry of Forestry make some evaluation, and we only allocate 1.2, and from that area is only 600 million will be digarap sekarang to make the work for the zone, and from this we give some license not directly to open to 600, but with the planning. So this already is already in the plan of that. Yeah.
Thank you. Bisakah saya dengan bahasa Indonesia?
Yeah.
Maaf.
Yeah.
Ya, jika kita menilik pada hutan di Gunung Kidul yang kita katakan itu adalah hutan lindung untuk monyet, tetapi dengan adanya jalan raya itu kan membuat binatang-binatang akan menyingkir. Jadi sebenarnya dengan membuka 600 hektar itu berdampak pada binatang, kan bukan hanya 600 tapi jauh diameternya akan jauh lebih besar karena mereka tidak mau beraktivitas near human kan.
Yeah. Itu juga salah satu one of these studies about the biodiversity also. So we include this survey, the study from the LIPI, the research institution, also from the university and from the office of this in the province also. We include already in that. Yeah.
Yeah, so she was asking, so for those who didn't understand Bahasa, so she is asking also for the study before opening the forest, whether the study includes also to study the One Health principle, including the animal behavior that will be affected by the land opening and in the forest. So yeah, so that was the study. If you maybe one last question, if
Yes,
you
thank
have
you,
any
Dr. Ruandha. I haven't agreed with that position, but I try to be a good citizen to support my government. For Professor, I would like to ask if agricultural could support the number of carbon footprints in maybe each of the food source choices, and then we could educate people using that numbers, that we can say if you eat rice you contribute to sekian. Thank you.
Yeah, so she's giving us the discussion on having the carbon label, such as because in health now we have the sugar, salt, and also oil, fat label. So she is suggesting how if we have the carbon labels, and maybe this discussion will also for Dr. Ruandha.
I will add the information as Pak Ruandha mentioned. Actually, we should in parallel. In one aspect, we can apply the extensification by opening the new lands, as mentioned by Pak Ruandha, maybe in small scale, but not directly. For example, 100,000 hectare, but maybe 10,000 is okay, can be manageable. And then second type, actually we can use the existing rice field, because in Indonesia we have 7.1 million hectare of the rice field, and then the total of harvested area only 10 million. So it means only we still cultivate one time, 1.3 times. If we can cultivate 2 times a year, actually there is addition of at least 3 million hectares. So I think maybe this is parallel. We can open new agricultural lands, but we can intensify of the existing of the farming land, especially in Java, in North Sumatra, in South Sulawesi. This is the center of the rice produce. And then second, about the carbons, I think good idea. We're trying to set up research with Sumitomo this year in East Java. We try to use the kind of the sensor if we reduce the water level, and then which number of carbon can be saved, can be sequestered, and then this is also kind of the maybe in the future by using some technology we can calculate, and then we can mention that kind of product related to the carbon and so on. So this is also quite challenging, but we are starting. Faculty of Agriculture now in collaboration with Sumitomo Indonesia and NTT Japan, we are trying making a pilot project how to prepare the watering system and then leveling of the water. Actually, the goal of how to reduce the use of the water, but also how to reduce the carbon number, and maybe in the future net zero net carbon, but positive. What kind of Pak Rwanda? Currently it's net zero, yeah, net zero. Maybe in the future surplus and so on. Yeah, we are trying, but still, yeah, maybe still far. We are still just piloting project, but yeah, I think good idea in the future.
Yes, thanks, Prof. Subejo, and thanks also for the discussion. We still have time. We still have 30 minutes for the discussion before the lunch. So, does anyone have any question? Yeah. So we have two questions here. So, yeah, the microphone? Oh, yeah.
Test. Okay. Okay. Hello everyone. My name is Muhammad Reza Valevi. You can call me Reza. I'm from first year of nursing science student from University of Gadjah Mada, and here I will ask Dr. Ruandha. Recently, I've been access one of your journals article. It's named Indonesia's Forest Resource Monitoring, and yeah, I've been like quick read about it, and it's been published in since June 2016. And the one thing that I want to ask you is about the data, maybe the data biases that happen in here in this journal. There is 16 usage of data which are published in 2008. And why so? I mean, the data gap it's so wide. I think you guys published it at 2016 about the condition of forestry of Indonesia, and you guys used the 2008 data of our condition of forestry. Thank you.
So thank you. So thank you, Mas Reza.
Tes. Langsung ya. Thank you, Mas Reza. About the data. About the data. Yes, Indonesia has call it the Simontana, System Monitoring Hutan Nasional, National Forest Monitoring System. And we have a historical data starting from 1990 until today. So we have a annual report for forest cover. Yes, and this data is already verified internationally by University of Maryland of US and also by the WRI. So it is the data also verified and make some validation by the international. So from this data, international gives some incentive by the how we can show the reducing emission from forest cover from Indonesia. So I don't know the journal, they get some data from a Ministry of Forestry or another data, because everybody can interpret their own data from the sources, from the satellite imagery. So Indonesia has our own methodology to do this one, and it's already verified by Maryland University of US. Yeah. Yeah. Thank you for your question, Reza. Yeah.
Yeah, thank you, Mas Reza, for your discussion. And we have another, yeah. Is there any question from the Zoom? No? No, okay. Yeah, please.
Thank you for the opportunity. Let me introduce myself. My name is Mekan Abdulfidiana. I am from Nursing Science Students, 2024. And I will ask about, with food inflation increasing, how can the government guarantee access to affordable food for the entire community without sacrificing. Okay. Without sacrificing small. Yes. Okay. I will repeat my. Okay, I will repeat. I will repeat my question. With food inflation increasing, how can the government guarantee access to affordable food for the entire community without sacrificing small farmers who are also affected by rising production caused by climate change, which causes crop failure? Thank you.
Okay, thank you. Very hard question, but yeah, actually, in my imagination, we can directly introduce triple strategy. I call as intensification, diversification, and extensification. So, in case of small-scale farmers, they should be educated not only producing one crop, but they should cultivate not only crop, but maybe livestock, and then also fish, and then also processing the product, so they can get. If they have problem in crop production, they still have livestock. They still have the fish, and then the other types intensification. So as I already mentioned, currently the local governments having enough money, so local government can introduce about the irrigation system, and then providing the seed, providing the fertilizer, maybe produced locally. And of course, for the urban people, the poor people cannot access the food. Government providing like a social safety net. So every year, the National Agency on Food, and then also Ministry of the Social Work, they provide for the poor people not only in urban area but also rural area, kind of the social safety net. For example, in 1 month they can provide 30 kilogram of the rice with very cheap or even free. But of course, the activities, economic activities in rural areas should be improved, and then small scale farmers can get income not only from the growing the food crop, but they can get additional income, for example, from small industry. And finally, if they cannot have harvest on food crops, they still can have enough money for buying the food and so on. So this is the combination, cannot the skill strategy, what should be combined in agriculture sector, industrial sectors, also the public sectors for providing the road access, providing the irrigation access, and also providing the market and so on. This is very complicated actually. If you are interested, I can send you some paper, because this is the issue of food security is very complicated and many issues should be solved, and we cannot quickly solve the problem, but maybe step by step solving the problem. Thank you.
So including experience economy, yeah, Prof. Wijaya? Yeah. So for experience economy that you have shown us the Nusa Tenggara Timur, yeah. Do you have any other example of like near here that maybe they can visit, maybe Gunung Kidul? Or,
Yes. Actually, not so far from here. Maybe only 1.5 hour from here in Ngelanggeran. We have a very nice place for like a big dam in the top, and then also cocoa processing. And there is a group of young men, we call it penggerak wisata, like a tourism activist, and then they organize themselves and they actively using the social media and then promoting the potency of the so many, yeah, including Langgeran, including pond, agricultural activities, and then culture. They inviting many people. And sometimes people from Jakarta want to bus, come to the village, and they stay in the house. Not hotel, there is no hotel, but distributed into house, farming household. Maybe one house can manage 2 or 3 people, and they can enjoy rural life. and then they can charge the people maybe one day, one night, 200,000 Indonesian rupiah, and they manage 3 people. It's mean maybe 600,000 Indonesian rupiah. This is big money, equal to one harvest time of the cassava. So this is also experience economic. And according to the activists on millennial tourism, many people enjoy. For example, when they preparing the land, many people enjoying playing in the rice area, and then they also giving feeding of the cattle, feeding of the buffalo, and then also catching the fish. Very interesting, very attractive, and I think in the future our local community could promote these activities, not only selling directly the agricultural product, but selling the experience from the people. Yeah, this is starting very near, Mas, from here.
Oh yeah.
Yeah, in Ngelanggeran, please come to Ngelanggeran. Yeah.
Yeah. So for those who don't know Ngelanggeran, we also have like the volcanic. So it's prehistoric volcano, and also we have a lot of things to see. Yeah.
Very famous song, Japanese song for this area.
Yeah, if we have experience economy as part to support the agriculture, so maybe do we have any experience? Would you say experience forestry or experience? So that we can give this so that we will give the experience to people that will support the forest also.
Yes,
Rwanda.
Thank you. Yes, in Ministry of Environment and Forestry, we have a program, we call it social forestry. So the program is provide the forest area that can be accessed by the people. So this they give the access for 35 years to maintain the area. They can make a plantation for the food, for the crop, for the annual crop, for the forest crop, and they can also trade for the carbon. So we facilitated also with a company people, and also the bank also to give some people to get access for the forest. And also we have program to give some asset for the forest. So the forest area can be excluded from the forest area and give to the people as their own land for the people. Yes, yeah. Thank you, Pak. Yeah.
Yeah, thank you, Pak Ruandha. So, is there any other question or discussion from the floor? Maybe following up discussion on Ngelanggeran, if you want to visit Ngelanggeran. Not so far from here, it's 30 minutes, and if you like to see cocoa, if the field visit will, yeah. Oh yeah, it's chocolate producer, but it's not one of the experience economy, yeah, Pak? Yeah, yeah. The chocolate, yeah, to process the cocoa. Yeah, so we also, as Dr. Ruandha also mentioned about the how that social forestry, the people can also use the forest. So how would you, Prof. Subejo, how will you like to respond about this thing? Because one of my friends, also Dr. Ruandha has mentioned before, use the land from Perhutani, so the BUMN for planting the coffee. And he just made also the experience economic over there. So how is the collaboration between agriculture, forestry, and also academic here from your experience as an academic, Prof. Subejo?
Yeah, I think a good chance for making collaboration between governments and then university and then community. Faculty of Agriculture of UGM introducing this coffee school. Yeah, near the Banjarnegara. Actually, this is the steppe area, and then use sedimentation on the big dam for electricity, and then the Perhutani Pak Ruandha, state-owned companies on forestry, inviting the UGM expert who to introduce the cafe in this area in order to reduce the sedimentation of the big dam. And then finally, farmer grew cafe, and then currently they introduce school of cafe, so people can enjoy how to process the cafe, and then enjoy in planting, and can buy the product of cafe process and so on. I think very interesting. This is collaboration between governments, community, university, and local people. I think in the future we should introduce more kind of these activities.
One additional information, and also the social forestry we provide also for the environmental services, like in the Kalibiru. Yeah.
Kalibiru?
Yes, yeah. Kalibiru. They use the forest for the ecotourism. Yeah. So the service of the environment they can sell to the ecotourism. So the people that manage the area, they can get some benefit from the forest by guarding this forest, and in return there is some money back to the people that manage the forests for the environmental services.
Yeah. So thank you, Dr. Ruandha, and also Prof. Subejo for the discussion. I guess this is the end of our panel session. Now it's 10 minutes to 11. So we would like to conclude this session, the panel.
Sorry, before the closing, there is a gift
for
Reza, Eureka, and Diana.
Yeah. So Dr. Ruandha would like to also give three of you the gift. So please. Yeah. Pak Jupiter?
Ini satu buat moderator. Pas. Ayo Mas. Ayo ini belakangnya. Terima kasih. Maaf belajar.
Thank you, Dr. Ruandha, for this beautiful gift. So this is the end of our session. Thank you for your participation in this session. Hopefully you'll get a new insight on the climate change and how we cope with the climate change and the mental health, also from the agriculture, also from the government, and it will give you the insight on how the climate change will also impact our health and how to mitigate the problem. So thank you and have a nice day.
Okay, thank you so much, Dr. Bagas, Pak Ruandha, and also Prof. Subejo. And once give big round of applause for our great speakers and moderators, everyone. Okay, so after this, you can enjoy the lunch outside of the rooms. And we will start again of the last panel after the lecture session at 1 p.m. And I will give you information regarding for tomorrow activities. Tomorrow you will go to the 10 points of Puskesmas in Kulon Progo Regency. So make sure you bring all belongings because you will live there in around 7 days. Okay, so prepare yourself and don't forget to bring medications, mosquito repellent, and other things that related to prevent you to be sick during your summer course. Okay, so I will give clear information after we finish the 5th panel at around 3 p.m. So enjoy the lunch and see you at 1 p.m. Check. Okay, so guys, we will start in a few moments. Please return to your seats. Check. Okay, so everyone, now we will start from the last panel from the lecture sessions. From the 5 panels, these panels will discuss regarding integrated approaches to climate change adaptations. And this panel will be, there will be 3 speakers in this panel. There will be 1 from National University of Singapore and 2 from Universitas Gadjah Mada. So some of you will still around the room, please join with me because we will start the 5th panels. And this panel will be led by lecturers from Department of Dental Biomedical Science, Faculty of Dentistry, Universitas Gadjah Mada, Dr. Gigi Aryan Morita, M.Sc, Ph.D. For the next around 2 hours, I will give the stage to Bu Aryan. Give big applause, guys, for her.
Okay, thank you, Mas Yopi, for your kind introduction. And good afternoon, everyone. It's nice to be here with you. And please allow me to introduce myself. My name is Aryan Morita. You can always call me Aryan. I am from Faculty of Dentistry in the Department of Dental Biomedical Science. And now I will be a moderator for the final session of the lecture for summer course 2024. So for today's session, I hope you still okay since you just finished your lunch. And we have 3 incredible speakers for the afternoon session. The first one is Mr. Jason K. Wei Lee, Ph.D. from National University. Currently, he is an associate professor in Yung Lu Lin School of Medicine, National University of Singapore. And his interest in sport physiology, and he will deliver the topic about the strategies to improve human performance in the context of climate change. And for Mr. Jason K. Wei Lee, he will be not physically here because we have the recording for his lecture. And for the second speaker, we have Dr. Barandi Sapta Widartono, S.Si, M.Sc, from the Faculty of Geography, Universitas Gadjah Mada. So please, Bapak Barandi, and give the applause for our second speaker. So his interest in disaster study, remote sensing, and GIS, and he will deliver the topic about remote sensing and health. And for our last speaker is Dr. Lisdrianto Hanindriyo, M.Ph.D. He is still not here yet, but maybe in a few moments he will be here. He is from the Faculty of Dentistry, Universitas Gadjah Mada, in the same faculty as me. And he is from the Department of Dental Public Health. And he will deliver the topic about green dentistry. So we make it efficient for this afternoon. Maybe we can start with the first speaker, Dr. Jason K. Wei Lee from the National University of Singapore. And as you may know that we have the speakers first, and then the question and answer session will be followed after all the speakers deliver their lecture. Okay.
No, I always say the best analogy to describe us is we are the boiling frogs. We are being cooked very slowly, and we are not even aware that we are being cooked. This year, we hit a 40-year record at 37 degrees Celsius. Bear in mind, in our context, it's not just about a high temperature, it's also about the high humidity. It is a problem that everyone will feel in the broader society. It's not climate change, it's climate crisis because we are right in the midst of it.
My name is Charles, and I'm a full-time food delivery rider. Every day I work for about 10 to 12 hours. So under the sun, every day, non-stop. During really hot days, it's really tiring. So after work, I don't really have the energy to spend time with my kids.
As we near the thresholds of human limits, any small increase makes a difference because at some point you can no longer lose the heat that you produce. Our leeway is getting tighter and tighter. And being in Singapore, I'm very proud that we are always proactive. No, we do not want to wait when that 40 degrees Celsius comes and then we ask ourselves, what should we do? The Heat Resilience and Performance Center is where we want to partner the best in class locally, regionally and globally to undertake research and innovations to augment heat resilience, profiling different populations to understand their vulnerability. So using science and technology, we will be able to quantify core temperature continuously in real time. Doing so, we can understand the impacts. We can also prescribe very targeted solutions to reduce heat strain. We harness an array of techniques. For example, we use the ingestible temperature capsule. You can swallow it the day before or the morning if your profiling commences at night. That allows us to capture thermal strain continuously, incorporates with heart rates, that is a measure of cardiovascular strain. Put the two together, you get an overall physiological strain. In tandem, we also put on a watch and there was an eye button, and that allows us to look at their skin temperature. In terms of real-time monitoring, we also want to build algorithms so that we can estimate heat strain non-invasively, and then very targeted solutions can be recommended. This job of delivery is of concern. You have factors that will result in a high heat strain or a hot body that we want to avoid. The impacts are impaired decision making. You might make a mistake and therefore accidents will happen. For Charles, moving ahead, I think we should have a sensor that when it crosses a certain threshold, there could be alert sent to the rider and say you probably have to take more rest, hydrate yourself before you get overheated.
Method to advise riders how to reduce heat inside them is a good thing for us.
That is how we envisage as we move forward. Don't assume a one-size-fits-all. You must have a very targeted approach. And therefore, often behaviorally, right, they will disregard the increase in environmental stress because they are there to earn. And also, they often differentiate. So it's wrong to assume.
A good example would be people with hypertension, maybe on beta blockers. And these are a group of medication that may potentially affect the capacity of the individual to sweat. And in diabetes patients, their ability to drink water in response to dehydration can be affected. And because of that, they can easily get dehydrated. And that state itself put them at risk for heat-related injuries.
Solutions could be very creative. A future mobile cooling center during periods of high heat stress. So let's tackle the problem upstream and not just be reactive. What we are doing here, a large part is the adaptation arms. We are buying time with these adaptation tools and solutions, pushing the boundary, right? Humans still need to survive right now, and that is essentially the mandate of what we are doing here. Welcome back, getting it. 50, it's pretty high. Yeah. It's not good just to live a life. We want them to enjoy their work out there. Solutions take time, but I'm an optimist. With science and technology, that is where we should push the boundary to augment heat resilience. This is especially important in a warming world that we are experiencing.
Heat affects everyone. Our loved ones, our athletes, our workers, and our soldiers. Imagine this. In the year 2100, each day could be up to 4.6 degrees Celsius hotter than what we know today. Climate change solutions will take time. We have to use this time to heat-proof ourselves. The Heat Resilience and Performance Center creates forward-looking solutions so as to be one step ahead of rising ambient temperatures. Our goal is to help humans survive and thrive in a warming world, and we are doing this through thermal research. We build cutting-edge, data-driven capabilities to drive research discovery. We make sense of information by harnessing the power of advanced technologies and deep data analytics, transforming knowledge into heat health solutions. By integrating ops, tech, and science, our studies will allow everyone to live, work, train, and play safely. The bedrock organizations anchoring HRPC are the National University of Singapore, DSO National Laboratories, and the Singapore Armed Forces. Positioned in NUS's School of Medicine for its strategy and focus on high-impact and innovative research, HRPC is a one-stop research capability poised to strengthen heat resilience research. Our capabilities include a large and connected network of researchers and practitioners. Over 25 years of expertise in thermal research, exercise physiology, and translational research. At our heart is a 1,000 square meter facility with state-of-the-art climate simulation and a full range of measurement tools and recovery technologies. The three thrusts of HRPC are discover, detect, and strengthen. Discover new knowledge and mechanisms that influence heat injuries. Detect in real time how heat-ready we are. Strengthen our heat resilience through novel and impactful heat mitigation strategies. Our goal is to be a global hub of thermal research, leading the charge towards thriving in a warming world. Heat will not set us back if we learn to push the boundaries safely. Even as temperatures rise, we can rise above it.
A heat wave is spreading across Southeast Asia as temperatures in Thailand reach 47 degrees.
It is hot. Earth's average temperature in 2023 was the warmest on record. Climate change is making heat waves longer and more intense. One of the worst side effects of the warming world is heat stroke. It can strike anyone, anywhere. Like these two hikers, whose day of adventure quickly turned critical as the sun climbed higher.
When your body overheats and can't cool down, it can damage your brain, heart, kidney, and muscles. The invisible nature of heat waves means we do not realize we are facing heat stress until it is too late.
Symptoms like dizziness, muscle cramps, and extreme fatigue can escalate quickly, leading to serious dehydration and heat exhaustion. As their condition worsened, their only hope was a rapid rescue. The hikers faced the harsh consequences of their ordeal. What happened to them could happen to you and I. But why is our Earth getting hotter? Our atmosphere acts like a blanket, trapping the sun's warmth. However, human activity has made this blanket thicker, trapping more and more heat. The result? Extreme weather events are happening more often. Everyone is at risk, especially pregnant women, children, and the elderly. What can we do to prevent heat illness? Let's start with making sure you stay cool in the heat. Drink water or other fluids at regular intervals. On hot days, stay in the shade if you can. Find a cooler spot to rest. Reach out to your neighbors. Check on them. Share what you know. If you're experiencing dizziness, nausea, red, dry, or damp skin, headache, or fainting, you need to seek urgent care. Heat stroke can humble the fittest among us. Beat the heat and secure your safety.
Thank you. Thank you for having me. And I think the previous speaker staged the scene nicely for me to zoom in to Southeast Asia. So I will start now. So again, just to say that I'm representing both the university and also recently we set out the WHO WMO Global Heat Health Information Network Southeast Asia Heat Health Hub. You will see at the end of my presentation, I will make a call to invite some of you to be part of this event in January 2025. It is the team, say hi, and they are still working hard as I speak. But I hope that for those who are looking for stints in Singapore, to consider the Heat Resilience Performance Center. Here we undertake work for research, but we also translate work through the Heat Health Hub. I hope by now we know we have entered into the new phase. It's no longer global warming. UN Secretary General has announced a brand new phase of global warming. If that is not enough, a couple of months back, there's a call for actions towards extreme heat. And on the same day, a parallel report was also released by International Labour Organization. I know there's a lot of journalists here, and I ask that you take the lead now how we comb this information out. Sometimes I find too frequent of the bad news can become common news. No? So there must be some science in dosing information too. In our part of the world, it is unique. It's not always just heat wave. In fact, one might argue in certain part of our world there is no heat waves. So for the longest time, we have assumed that no problem. It was always hot, still hot. It's going to be a bit hotter. We tropical natives are very good, and therefore heat is not a problem. Until you quantify it in other indirect impacts. In Singapore alone, we avoid the heat, and therefore we are paying the price of indirect impact on heat avoidance. Of course, we still have workers, soldiers, firefighters, law enforcers out there in the heat. So I say that we are experiencing both the direct and the indirect impact, and we are chronically exposed to this heat, which means lower productivity, higher exposure, compromising our decision, leading to accidents. So there's a lot of things underneath the carpet. It's not just no heat mortality, no problem. So if you could take a family portrait, this best represents us. For the longest time, we are the boiling frogs, just complaining about thermal discomfort, but lack of actions. There's one slide at the top of the iceberg. I have no time to elaborate each of these. Some are common, some are least common. I bet not many in this call are even aware that the high prevalence of myopia. I see on the screen, many are wearing spectacles. I'm putting hard lens at night to cure my eye disease. You might not be aware that it is so due to lack of outdoor exposure. So don't assume living in a hot environment for many of us in this call means we are overexposed to heat. The chronic avoidance of heat has incurred another list of problems. Physical health, mental health. Look at underneath the iceberg, there are a lot more that needs to be quantified. Put it from a societal, from an economic perspective, we are losing billions and billions unknowingly. So there's still a lot underneath the iceberg. I ask that people in this call go about quantifying it. Like it or not, some decision maker requires an economic imperative for them to invest more in the extreme heat. So in heat, occupational heat, you know by now, often these are the three bubbles we are after: heat injury, productivity. Our focus in the third bubble, accident prevention. More often, but less understood. So we saw this study clearly shows that when you are thermally uncomfortable, you don't have to be boiling hot. Uncomfortable, you will perceive the risk differently. You want humans, in this case workers, to perceive the risk correctly. If not, there will be lack of corresponding actions. We recently repeated this study in another context looking at emergency workers. They are not hot to be concerned of getting heat stroke, but definitely thermally uncomfortable. When we administered a risk-taking test, we found those who are thermally uncomfortable tend to take more risk. Not good for them, not good for the patients under their charge. It was very powerful because them serving as their own control when we give them a cooling intervention, in this case, drinking an ice slurry to remove the thermal discomfort, the risk-taking behavior decreases accordingly. So it's not just about productivity, heat injury. It can help you make better decisions and therefore avoid accidents. So I'm a physiologist, so I love this slide. This is my favorite slide. To beat the heat, you must start cool, attenuate the rise, and extend your own limits. By doing so, look at the y-axis, your ability to tolerate heat is now expanded. And this expansion has a direct positive implication on your ability to do well in a hot environment. This slide is my favorite. I need to repeat this one more time. So without doing anything, we are doomed. Very quickly, we will succumb to heat stress. So if somebody comes to you and sell you a gadget that can beat the heat, it must either reduce, attenuate, or extend. By doing so, you can tolerate heat and you will do well and do safely in the hot environment. And these are the list of not just effective, but sustainable physiological solutions that you can use to beat the heat. Look at the number one on your left. Nothing beats good, solid aerobic conditioning. So that's the tricky part, right? As it's hot, you avoid outdoor exposure, but as you find ways to keep yourself fit. One who is aerobically fit, they can deal with more stressors, including heat stress. Look at the bar on the left. On your right, hydration. It only ticks one of the three boxes. It attenuates the rate of rise, but do not overconsume. People think that you can beat the heat by drinking as much as possible. You can induce water intoxication. So harness these techniques holistically and don't just think that you can drink your way out of heat. Finally, I just want to quickly share Project Heat Safe. This project just completed. We went around Cambodia, Vietnam, even South Korea, plus Singapore to quantify the impact on heat on workers, looking at it from a multi-dimensional lens, not just a physiological lens, from an engineering, medical, economic, social, so on and so forth. Again, I have no time to elaborate. These are the representative places we went to, but I want you to focus the picture on the top center. They were delivery workers in South Korea. The condition then was 20 degrees Celsius. Most of us in this part of the world say that will be our winter. If any, in Singapore, there's no winter, right? Likewise in Indonesia. But that will be the coolest environment. But that is the condition where they were the hottest. They were physiological strain the most. Why? Because for workers, it's not so simple to assume that hot environment leads to hot workers. Because if the weather is not so hot, the workers work very hard, which was the case. They can get very hot. So this concept I want to emphasize in this talk is not just climate resulting in a hot body. It's a function of the weather, the climate, the clothing, and the exercise, the kind of work you are doing. The only group in these photos is the center group that are being paid by P. So they have additional motivation to work as hard as possible. Whereas the rest are fixed pay. There's no motivation to work extra hard because they get the same pay at the end of the day. Also, it's a little bit more sophisticated, but again, I will not elaborate. When we profile them using physiological technique as a group mean, most of them were actually okay. Look at their core temperature and their physiological strain. From a physiological standpoint, this would have been considered no problem, way below the threshold. But troubles and accidents occurs in the outliers. I give a couple of examples. One person could be due to his weight status, could be due to Ramadan. He exceeded the occupational limit. In this case, went as high as 38.6. In another case, in the indoor worker, which we thought that is not a problem, not true. Indoor places can be not ventilated. There could be extra heat sources. In this case, there was a worker working as high as 39.4. He was indeed boiling underground. Thank God, nothing happened. But these are the individuals we want to pick up through another layering, maybe be physiological sensor, maybe be additional layers of heat management to whiff and pick up every of these outlier. Finally, that is work package that we look at 3 interventions: education, inserting more bricks. I say it again, more bricks. You'll be surprised afterwards, you'll see more bricks do not equals to less productivity. And finally, we also look at their attire. These are the representative photos by educating them, debunking them, giving them shade and more rest and the right attire. We found, this is a very important finding, more rest resulted in better productivity. I said again, right? A lot of chairmen assume, oh, this guy is talking about providing more welfare. Maybe it's a conversation of getting less productive and more welfare. That is a wrong assumption. If you insert the rest correctly, it can not only protect the workers for a more sustainable workforce, it can also be good for your bottom line, for your business. Because many of these contexts, the workers are paid by the fixed sum. If you don't insert rest properly, they find very creative ways, sometimes voluntarily, sometimes involuntarily, to avoid excessive heat built up, and therefore the price is a reduce in work productivity. Very glad to conclude this part. We need not just the technical specialists, not just the government, not just the enterprise. We need everyone to work hand in glove. Yeah, so I'm very proud, let's say in my context, the ministry that is responsible for workers is called Ministry of
Okay, I hope you are still taking the note about the first speaker lecture, because I just realized that around 20 people are from the Netherlands, and I hope you guys are okay with the climate here, because we know in the Netherlands it's quite, yeah, maybe now it's entering the autumn, right? So like most of the time it's windy, and then here is like sunny every day. And okay, so let's just continue to our second speaker. Please welcome Dr. Barandi Sapta Widartono, S.Si, M.Sc, M.Sc from the Faculty of Geography, and he will deliver the topic about the remote sensing and health. Pak Barandi, time's yours.
Okay, mohon izin. Thank you, Mbak Aryan. Hello, everybody. Yeah, nice to meet you all, and good afternoon. Yeah, I hope in this afternoon you are smile and happy, because maybe this day is the last day in the lecture, and tomorrow you can go to the field trip. Okay, yeah, I think the Kulon Progo is very nice place to go around to looking for the landscape. Okay, enjoy tomorrow. This is my topics about the integrated approaches to climate change adaptation. Yeah, from the remote sensing for health angle. Yeah. Okay. Okay. Next. Mati ya. Okay. I get it from the WHO about the key facts of the climate change. Yeah. We know that the climate change will give the change about the many things. Yeah. One is humanitarian emergencies, yeah, for from heat wave, with fires, floods, tropical storms, and hurricanes is looks like a disaster in the world. Yeah, we can know about the disaster is maybe because the change of the world, because change of the earth, and we can identify it from the small scale to the big scale, and we know also about the frequencies and intensity of disaster. But for this topic, we know that the climate change maybe also give the effects to the health of human. We know also that the 3.6 billion people already live in area. I give underline to the areas because the spatial information is very important in remote sensing. Highly susceptible to climate change between 2030 and 2050. Climate change is expected to cause approximately 250,000 additional deaths per year. Yeah, we know that is something that I think is very important to how we can affect it to as a human to make it stable. Areas with big health infrastructures, mostly in developing countries like Indonesia or something else, will be the less able to cope without assistance to prepare and respond. Yeah, because sometimes we have a vulnerability of people that have to be prepared because the climate change sometimes make change about the condition of their environment. So we have to prepare about that. But if we want to prepare about that, we need some information. We need some data to make. Maybe we have to fast respond about the will be change and will be come to us like a new disaster or something else. So I hope from this key fact of the WHO, we have to prepare for that. Okay, that is also from the same sources about the health risks. Yeah, we know that we have the vulnerability factors, demographic, geographical, biological factors, and health status, socio-political, socio-economic, health system capacity, gender, and equity. That is the vulnerability factors that we have to. Okay, this the factors that we need to be prepared about the information that we have to make it before the disaster is happen. And number two is climate related hazards. Yeah, we know that the climate change will make an extreme weather events, had sea level rise. Yeah, maybe for next month I'll be go to the Kota Baru in Kalimantan. They have some disaster in extreme of the wave, sea wave, and also the many things from the disaster. So we have to give an assessment and give the mitigation for how to the people can prepare about the disaster will be happen. And also air pollutions, factor distribution and ecology. For this, I will be given some example in my the end of the presentation. Also, water scarcity, reduce food production. That is a climate-related hazard that will be affects to the factor of vulnerability. Who will be exposure of the health risk is people and communities. So tomorrow in Kulon Progo you can go to the puskesmas that have some case about the infected of malaria. Yeah. Also the health workforce, infrastructures, energy system, and etc. So what is the health outcomes? Yeah, there is the example of the can you see that the oh this the health outcomes, yeah, about the injury, health related illness, respiratory, yeah, cause the air pollution, waterborne disease, yeah, zoonosis, you can find it in Kulon Progo tomorrow. I hope you can ask to the offices at the Puskesmas, and you know that I hope the anthrax have the Kulon Progo, yeah, yeah. I don't know. You go to there or not, yeah. But there's some zoonosis is also happen at the Kulon Progo. Vector-borne disease, Kulon Progo have eliminated at the 20 and 21, I think, but because they have in one ecological of the Menora Hills, so if the Kulon Progo is eliminated but the Purworejo or Magelang not, so the malaria will be occur. Yeah, so there is my dissertation. If you want to know about the malaria in Kulon Progo, especially in Menora Hills, there is endemis of malaria. Yeah, but I hope now will be eliminated. Also for the malnutritions, that is our president's program for the food and also mental and psychological health. Okay, I pass it. Yang bawah. Okay, if you want to know about the climate change and how to the data of the change using the remote sensing, we have to understanding about the small part of remote sensing is about the system and also the process and also the how to get the data from the remote sensing platform and something else. Yeah. I give it in four parts. I hope this will enough time to explain to you. First is remote sensing system in general, remote sensing data sources. I think for this year or era, I think it's very easy to get the information about the remote sensing data. Number 3 is integration of remote sensing with GIS. I hope you know about the GIS. Yeah, yes. I think it's for the 10 years is very popular about the geographic information system, because they can integrate it all of the spatial data and get the new information, and we can the information to make a decision. Support system. The number 4 is integrates climate change to various health issues, but not various. Maybe just one, because there I think is a very limit time to discuss it, but it's okay. Maybe you can give an ask to but health issues. That is the remote sensing process. Yeah, this is A, B, C, D, E, F, I, G. Yeah, we need the sun as ray sources. All you can use the yourself electromagnetic wave. Yeah, you can use your own, or you can use the sun to get the energy. Also, the energy will go to the surface of Earth. In between have atmosphere. Yeah, Sometimes the information that we can get from the remote sensing is about the atmosphere. So the information is get from the atmosphere area, and sometimes we get the object or something else from the surface of the earth. Is C, interaction with the target in the surface of the earth. And we can recording of energy by the sensor. So you know that the sensor is many, yeah. You can using the camera, using the sensor of infrared, thermal, or something on other sensor, and also the data can be transmitted to the earth, or you can get it yourself and download it from your platform. That is number 6 is interpretation analysis. But I think it's very important because the interpretation analysis is one step to how the information from the sensor or the data from the sensor we can change to the information that we need. Yeah, this is many method to get the information from the imagery to the map, yeah, or to the spatial data or geospatial data. The end is application. Many things to use from the remote sensing data for the many thing application. If you see, there is many sensor to get the data from the surface of the earth or maybe in atmosphere. Remote sensing approach generally produce data imagery in the form of area. We can see, sorry, we can see that this is the aerial photography, and this is the digital of the imagery from satellite or sensor that get the information as a digital number. Yeah, digital number has a meaning according to the result of the reflection or emission received by the sensor. So for the remote sensing interpreter, they have to change the digital number to be an object or to the thematic information that we need to analyze. Yeah, this is many method to do. Yeah, sorry. Yeah, this is the remote sensing platform. Many, yeah, from the ground base. Sometimes we use the object from the ground, or airborne from the UAV to the aeroplane, and also spaceborne. But this is a different method to get to acquisition the data. Spaceborne, they using the orbital. So they have a repeated time, continuous, periodic. But airborne, we have to make a flight plane and have the plan to when we can get the information in our period that we have to plan before flights, using the navigation, flight plane, and also how big's area. But when we fly high, we get the big area, but when we go down, so the area is narrow. So but if your altitude is lower, the information will be detailed. But if we get the from the sky or from the satellite, the information is coarse, but can reach a big area to get information from the sky. Okay. Kemana saya harus kliknya? Ke sana ya. Sorry. Sudah. Harus kemana? Oke, ya. Need sama. Ini harus kemana nih? Next slide. Okay, thank you. Yeah, this is objects observed by remote sensing. Yeah, each object has a different response to the electromagnetic wave received and will reflect and or be transmitted to the sensor. So this is the principle of the remote sensing, that every object have different response. Yeah. I will give the spectral curve of the object. The second one is the interpreter and or certain algorithms from the image processor will identify the recorded objects with various methods and technique. So this is the remote sensing. Sometimes we have to know what's the advantages of the some sensor and satellite or method to get the perfect information that we can get. So those objects can be identified with a certain level of accuracy. Yeah. All recorded objects will be classified according to the theme to be produced. Of course, the selection of platform, sensor, and interpretation methods will be adjusted to the chosen theme. Okay, next. This is the spectral curve. You know that the reflectance spectra will give another response difference between one band to the another band. Like the visible, we can get it from the 104 till 107 wavelength micrometers. Yeah. Sorry. I think this is a visible information, and this is a near infrared, and this is the for near and infrared, long infrared, yeah, and middle infrared, and we can expand it to another band from the sensor like this. You know that we can get information about the gas from the sky use the expand the wavelength of sensor. So with the sensor of remote sensing, we can identify, but you know that we have the more or less bias of the information that we can get. We know about the ozone, carbon dioxide, water, and many things. Objects can be any phenomenon on the surface or below the earth. So not just in surface, but sometimes in below of the earth surface. Spatial aspects, object detail, spectral, radiometric, and temporal aspect produce are highly dependent on the method used. So spatial aspect, I think, is important because every material gives the different aspect, a different spectral response of the sensor. In addition to identification, data with different time element can produce information on change in object or phenomena, and can produce trends if change in various time series. So with remote sensing, we can identify the object, and if we have the data in the one time, or we have the time series, so we can get the change of the land or theme, or if we have many themes, so we can get the trends. Okay. So climate change, one of the information that we can get from the remote sensing, but you know that is not just in one time, but we have to collect in from maybe a long time to get the information about the earth from the satellite, and we collect it and we can make it a database, and we can look one time to another time. So we know that the trends of condition of the earth and environment, we can know how the big of the change. So we using the remote sensing, we know know about the environment change in the world. Okay. This is difficult of the, or maybe like how the GIS or remote sensing can identify the information. One, we have the base data. After that, we can derive the data from the base data to a new data like a slope, aspect, watershed, stream buffer. Yeah. For the, maybe you know that the stream, it not get from the, sometime not get, this is the river and we can delineate, no. But we using, sometimes we use the elevation, and after this elevation we can get the 3D model. 3D model, we know the stream network. Yeah. And also we can get the new information from the interpreted for the habitat, aesthetic, base road, and something else. So the data of the remote sensing, sometimes we can, the easy way to get the information, but sometimes we have an association or something, an analysis or algorithm to make a new data that cannot directly get from the remote sensing data, but we have to analyze image processing or something else to get. But fortunately now you know we have the artificial intelligence. Yeah, they can do automatically. Yeah, but we have for the human or interpreter, we have give the library and also give the algorithm to AI to make information. Yeah, thing related to remote sensing, very good at knowing and determining location and area. So remote sensing is also as geospatial data. Yeah, one of the geospatial data is spatial data from the remote sensing in various scale of study. You know, I have told before that we can use UAV or drones, or we can use the satellite. Knowing with sufficient accuracy and speed of information that is sufficient and can be scientifically accounted for through a certain approach. Yeah, data in the form of geospatial can be integrated with each other through GIS. So GIS, one of the data can contribute to analysis is from the remote sensing, because remote sensing is better accurate from the, but sometimes that, how about the field trip, field survey to get the information? Yeah, field survey is best, but they sometimes have the limited areas. Yeah. But if we can integrate it, remote sensing and field survey, we can the best information, get the information of area, location, and also the information that we can detect from the ground survey. This is object clearly visible. Yeah, you can using the aerial photograph. Yeah. Sometimes it's very easy to get the information of settlement of the river, of the agriculture or something else. It's very easy. If you get the information visible is what you see, what you get. Location, shape, and boundaries can be easily delineated. You can see the right side of the image illustration. Yeah, I think it's very easy to get the information of the object from the aerial photography. That is from the satellite. Yeah, from the satellite with periodic in 1 month in July 2015. We can see from the Astar Global Emissitivity, this is the head of the all of the world, of the earth. Yeah, we can see that the deserts in Australia and Africa and maybe in Asia, Gobi and something else. Yeah. Sorry. Indirectly, this is the second opinion to get the information. If we cannot see direct from the data in imagery, we can use the another method to get an indirectly. Yeah, object recognized by associate with something. Yeah, or using interpretation algorithm, or we can using the artificial intelligence. Okay. This is the example. You can see in two year, yeah, about the vegetation time lapse. Yeah, we can see in one musim season, in one season. Okay. This is using the remote sensing that we can collect it periodic in into a year, so we can get a one period of season. This is the integration using GIS. Every information from sources, from the GPS, remote sensing, environment field survey, and something, we can make it to be a spatial database, and spatial database can be analyzed using GIS, data management, and many things data that we can make it to be new information from spatial database. Yeah, so you can get, so this GIS, sometimes we call it mixed data system. So you have another information, you can get it. That is the principle of epidemiology. We have host environment agent. If the environment is changed, I think maybe some thing will be changed also. That is the last. Sorry, this is my topics in the thesis. You can read it, how to get the information about the receptive area. This is the Kulon Progo. Tomorrow you can go there. Yeah, and you can see that this is the malaria receptive area, and if the malaria come to the Menora Hill, I think the malaria will be happen at the Kulon Progo. Okay, that is my presentation. Thank you, Bu Arya. Silakan.
Yeah. Thank you, Pak Barandi. It's a very interesting topic indeed. But please, for the audience, keep your question with you, because we still have our last speaker, Dr. Gigi Lisdrianto Hanindriyo, M.Ph.D. from the Faculty of Dentistry, Universitas Gadjah Mada, and he will deliver the topic about green dentistry. So, Pak Trian, time is yours.
Thank you very much, Dr. Aryan. Hello, everyone. Good afternoon. Are you still with us? We hope so. Okay, first of all, of course, I have to mention my highest gratitude to the committee that have given me a chance to be here this afternoon to meet you, because the committee asked me to deliver topics related with dentistry and climate change. So I could not think anything else than green dentistry. So does anybody here came from dental school? Is there anybody here came from dental school? Okay, from Indonesia? Okay, so most of you are from medical school, right? Okay. So, okay, I will start my talk by giving you the content of my talk. So I would divide my presentation into 3 parts consecutively. So the first part would be the background. So within this part, I'm going to tell you about how dentistry have contributed to climate change, maybe, even in a small amount of it. And then how the correlation between dental activities and environmental issues. And then after that background, I'm going to jump to, well, it's not a history actually. Well, I'm just going to tell you a story about how the awareness of green dentistry started in the field of dentistry until what we are doing right now in the field of dentistry. And then the last part would be the key principles of green dentistry that we should follow. So during my presentation or my talks, if you want to interrupt me, then just feel free to do it, okay? Okay, so I'm going to start with the first part of my talk, which is the background. So, as you can see in the slides, unfortunately, I could not find proper data for Indonesia, but from these 2 countries, Australia and Japan, at least maybe I can give you a glance of how dental activities or dentistry are contributing to the carbon footprints in the field of health care delivery systems. So when we look at the left side of the figure, the left graphs, we can see that in Australia, dentistry are comprising of 3% of carbon footprint, total carbon footprints in healthcare system. While if we looked at the right side of the figure, we can see there that the highest carbon footprints are produced by medical services, and dental services are part of that medical services, and it's maybe the same, maybe within the same percentage of what it happens in Australia, around 3%. So actually it's not so high. But of course, even though it's not high, but of course we need to give some concerns about what we do in dentistry to reduce this carbon footprint, to ensure the environmental sustainability. Okay, so the next slide, within this next slide, so my slides would mostly giving some graphs and pictures. These are the aspects of dental treatments or dental care, healthcare delivery, which produces the most carbon footprint. In the left graph, we can see that most of the carbon footprint are produced by patient travel and staff commuting. So it's very clear that because in dental treatments, people have to come to the clinics. People have to come to the clinics to get treatments because we are doing intervention. We are doing restorations, we are doing extractions, scaling, etc., which can only be done in dental clinics. So patients need to travel to the dental clinics, and of course also with the staff. But on the other hand, we also have procurement and then gas, electricity, which is directly correlating with the intervention that we did. So as you can see there, the highest CO2 emission production are from relative analgesia, the usage of nitrous oxide. So actually in Indonesia, this is not a common practice, but I know that overseas in developed countries, nitrous oxides are common practice to use, especially to children, patient, right? Sorry? No, it's not the spray, but it's for analgesia. So when you got a very anxiety patient, like small children, then you can use this gas to make them more relaxed to receive the treatments. So actually that produce lots of carbon footprints. Also with the second one is dentures. Making dentures, I'm going to give a little bit more details in the next slides, but making dentures in conventional way is producing greenhouse emissions, which is the second highest rank, because we need to have impressions, and then from the impressions, then we need to have a mold. From the mold, we have to transfer it to the dental technician, and then they should produce the dentures and then give it back to the clinic. So it costs a lot of emissions. And then, of course, with crowns and root canal treatments and study models and composites. So each of dental treatments, they are producing carbon footprints. And then we can also think about the water usage for at least oral hygiene practice. So we always ask people to brush teeth at least twice daily. But when we calculate if one person once daily, just once daily, they brush their teeth, they will use at least 600 milliliters of water to rinse, gargles, and then to wash the toothbrush, and then gargle again. So if only half of the people of the population of the world are doing that, one day we consume 2.4 billion liters of water, which is equals to 480 times as big as Olympic game swimming pool amount of water. So that's a huge amount of water that we use for oral hygiene practice. And then when we look into deeper of what we do in dental treatments, we have the problem of linear economy supply chains. So in dental treatments, we use lots of materials, restorative materials, dentures, we use extractions, analgesia, and etc., which of course the raw materials are coming from the nature, and then it has to be manufactured, and then the next will be packaging, distribution, procurement of the clinics to get these materials, and then when they use it in the dental clinics, after that it's going to be ended up with the waste disposal, either within the landfill or maybe in the incineration. So it all ended up in waste disposal system. So huge waste that we produce. So on the right sides of the slides, we can see this restorative materials, and lots of plastic instruments. So those are the things that we use in our clinics, made from plastics, and we don't know if it can be recycled or not. We don't know if it can be reused or not. And by the restorative materials, as you can see that there's dental amalgam, which is an alloy which contain mercury. And even though we are now having the resin composites based restoration, but it's still, amalgam is still used in countries. Do you have any silver fillings within your teeth? You still have it? Where are you from? Makassar. Okay. '90s. Fillings from 1990s. Okay. Anybody else have some silver fillings with tooth? Well, that's good. Well, that's good. Yeah. Because, yeah, even though we have agreed that we should not use this material, there are some countries that still using it, because this is actually the strongest material, restorative materials up until now. Okay. Yeah, not to mention SUPs. So we, in the field of healthcare, are always using SUPs, or single-use plastics, every time we do treatments to hinder or to avoid the cross-infection. You're right. So this is a table from UK. In our dental setting, if we they are counting number of SUP items used in every kind of dental treatments, endodontics and then prosthetics, restorations, and etc. And then when they sum up the total number of SUPs and PPE, personal protective, 1 year we use around 1 billion PPEs for dental treatments. So it is a huge number of waste. Yeah, if we could not do anything with these materials, yeah, huge number of waste. When we move to amalgam, as I mentioned earlier, it contains mercury. And mercury, when released into the environment, can be very toxic. And one of the source of the mercury is from the silver dental fillings. And mercury can also have causing the health problems, short-term effect or long-term effect. Have you ever heard about Minamata disease? Minamata disease, have you ever heard about that? Okay, so I'm going to tell you a little story about Minamata. So Minamata is a city in Japan, in Kumamoto Prefecture. So around 1950s to 60s, there was a big company, and this is a chemical industry. And then this company has wastewater to be spoiled to the river and sea, ocean. And the people from the city, Minamata City, are eating the fish which is contaminated by mercury. And within that 10 years, there are also mortality caused by this health incidents. So since 1970s, people are aware about the poisonous of mercury. That's why United Nations was having a Minamata Convention. So this is a international agreement that aims to protect people and the environment from the mercury. And as we all know that mercury are used in many health devices. That's why health sectors have to be able to cut down the use of mercury. So as you can see in the figure, first is to phase out thermometers and blood pressure devices that contain mercury. So nowadays, even in hospital accreditation, there should not be a single mercury contained blood pressure devices. If you still have one, then you should waste it. And then number 2, promote oral health and reduce dental amalgam use. Yeah, so it's one of the main thing that Minamata Convention also highlighted. Implement strategies to protect small-scale gold miners and other vulnerable groups, and monitor mercury exposure and produce health advice. So actually, dental amalgam is also only 1% of the contribution of the mercury release in environment. But still, we need to follow this action. So the second part of my talk would be the history of green dentistry. So first, we need to know the definition of green dentistry. Green dentistry refers to dental practices that prioritize environmental sustainability by minimizing waste, conserving energy and water, and utilizing eco-friendly materials and methods, while maintaining high standards of patient health and safety. So we need to minimize the waste within our practice. We need to conserve energy and water. We need to utilize eco-friendly materials and methods of treatments. But on the other hand, we still have to keep the high standard of patient health and safety. So it was all started in 1970s when the environmental movement are being an issue in the world. And one of the issues is also the dental waste. And then in 1980s, sustainability in healthcare are being promoted, and waste management and eco-friendly of dental methods are also advocated. In 1990s, fortunately, we found a biocompatible materials for at least for dental restoration. For example, GIC and RBC, glass ionomer cements, and resin-based composites. Within 2000, green dentistry term is established in 2006. So the green dentistry terms are starting from 2006. And green dental practice establishment was started at that time. And on 2010, there are some professional organizations supporting this movement, like ADA, and there are also an organization named Eco Dentistry Association, or EDA. And in 2020s, we have regulatory initiatives for green dentistry and some technological advancements. So I'm going to talk about the technological advancement later on within the slides. The next part, or the last part of my talks, will be the key principles of green dentistry. So previously, I showed you the linear economy supply chain. So within green dentistry, we are trying to have a circular economy supply chain. So it is aimed that we are not producing so many waste disposal which ended up in landfill or incineration. So we need to think about how to reuse or recycle all of the materials that are being used in the clinical care, and then to reproduce it into another materials or the same materials. So this is starting now, this movement. And then we also have 4 R's in green dentistry: reduce, reuse, recycle, and rethink. So in reduce, we should minimize waste generation and resource consumption. For an example, we have to use digital records or electronic medical records to decrease the use of paper, and then inventory management, water usage control, and energy saving methods, and chemical waste management. In reuse, we have to find ways to use material multiple times or instruments multiple times instead of discarding after single use. So instruments or instruments especially, which can be sterilized to be used over and over again, to not to use the single use instruments. And then recycle, processing materials that would otherwise be discarded. So this is like what we have seen in the previous slide. We are trying to recycle the paper and plastic things that we use in our clinics, and then also with paper, and we should manage also the waste. And rethink, critically evaluating existing dental practice, policies, and materials to identify opportunities for improving sustainability. Assessment procedure, material choices, patient education, and sustainable practice. So I'm going to give you one or two examples of what we did. So we are now having the CAD/CAM technology. So previously, when we want to make dentures or crowns and bridge here, then we make dental impressions. After that, we make a positive mold with gypsum and then send it to the dental technician. And they would make this kind of crowns for tooth. But now, we can have an intraoral scanning machine which connected to the computer, and then this information can be sent to the dental technician, and they can have a digital printing method that produce the same thing. So it means that we are cutting down lots of procedures, lots of materials that is used. So this is very effective and efficient and carbon footprint reducing action. And then we also have digital X-ray system. In the conventional way, we put the film inside the oral cavity and then give the X-ray, and then the film has to go to the liquids for development and then for fixation and for cleanings. And we have this kind of radiograph. But now we can have an X-ray sensor inside the oral cavity and then do the X-ray and get the results on our computer. So it's also cutting down lots of materials and time, also with hazardous materials of the liquids for fixating the radiograph in films. For restorative materials, we are now having the composite fillings. So this is very comfortable. When we use amalgam, we need to make some manipulation. We have to triturate the mixture of the powder and the mercury. And it is resulted in a waste of mercury that might be we threw it into our sewage water pipes. And yes, it is strong, but still it's very hazardous. But when you use composite, then it's very easy. We just have to put these materials inside the cavity, and then after that we can use the light curing. And I'm sure that you are also familiar with this kind of fillings. So this is also cutting off all of the carbon footprint, even though we still also use plastics. Yeah, but above all, what we advocate in green dentistry is just to keep the good oral health as long as possible. So if we can have a preventive care over any other type of care that we have in dentistry, so it means that people can get a good oral health, good oral health will be good for the patient, of course, and good for the environment. Because without having treatments, we can have fewer appointments with the patients. We can have less waste production. We can also have fewer patient journey to come to our clinic. We can have many other things to cut down the carbon footprints. Preventive care become the priority, and then operative care with effective and efficient methods. Integrated care will also have to be advocated, and ownership of care. And for personal oral hygiene practice that we should also remember, if I mentioned to you that oral hygiene practice consume lots of water, actually we can also cut the use of water with oral hygiene, because nowadays we have the non-SSL toothpaste. Why we need to gargle? Because actually we don't like the bubbles when we are toothbrushing, right? So we need lots of water to clean it. But non-SSL is non-detergent toothpaste. It doesn't produce lots of bubbles, and we don't have to rinse our mouth frequently. So even though actually rinsing is not having that significant effect of cleaning our oral cavity. So the most important thing is the mechanical brushing action, okay? Yeah, saving water, as I said earlier, and using the, if it's possible, recyclable toothpaste container. If you come to a dentist, then you should consider whether the dentist have the environmentally sustainability policy. Ask about booking family appointments, if it is possible. Ask about combining several appointments, so we don't have to go back and forth to the clinics frequently. And then ask for your dentist about recycling scheme, and ask for electronic invoices instead of paper invoices. And then what we can do in our dental team to make a change in the environmental sustainability, we have to build a strong patient-clinician partnership, conduct energy audits, talk about sustainability, recycle whenever possible, and then promote sustainable transport, embrace digital technology, focus on prevention, conserve resources, use good materials and use them well, and learn and develop best practices to make a very effective and efficient treatments. Last but not least, to reduce the CO2. So most of you came from the Netherlands, so you are very familiar with cycling. But the other thing, the other way around in Indonesia, we don't like to use bicycle. Everyone using motorcycles. Yeah, we should try to reduce the uses of motorcycles and use more in public transportation and cycling and walking, as well as using teledentistry and mobile dentistry options. So I think this is the last slide of my talk. Thank you very much for your attention. If you have some questions or comments, please feel free to. Thank you very much.
Okay, thank you, Dr. Drian. And now we are entering the question and answer session. And please, for the audience, raise your hand and don't forget to say your name and for which speaker your question will be addressed.
Hello, my name is Alejandra. I'm from Italy and I'm a master's student in International Humanitarian Action. I have two questions. The first one is concerning the new technologies in green dentistry. You mentioned before that, for example, Catman was introduced. Do you think that this kind of technologies is well diffused in this part of Indonesia?
Shall I directly answer the question?
Yes, please.
So you were asking about the CAD/CAM technology, right? So if you are asking it whether it is used in Indonesia, I should answer yes. But not most of us are using it because it's very expensive. However, this is something that we, of course, need to advocate because even though it's expensive, it's a very good infestation for dental practice. Yeah.
And do you think that there are enough national programs to do investments on it?
National program to do investments?
Yeah.
You mean?
National funds.
Oh, okay. No, for this kind of instrument, we don't have national funds to advocate the use of CAD/CAM up until now. Actually, in Indonesia, for oral health, we have the national health insurance system only for basic dental health care.
Thank you. And my second question is revolving to the job in local communities, because you mentioned before that you are doing a kind of implementation preparation before disasters, if I'm not wrong. And I would like to ask if how's the interaction with local people when you go there?
So your last question will be addressed for Pak Barandi. Okay, Pak Barandi, please.
Okay, thank you. Yeah, preparation is we can get the preparation from the historical of the disaster event, and sometimes we can read the maybe like phenomena that is happen from our analysis in imagery to get the what will be happen with the trend of the data that we have. So sometimes we need some data series from the remote sensing, like a satellite or something like that. Maybe they have the global information in our country or your country, and we can read like the meteorological bureau for the information for that. So that will be give to the community to prepare about the disaster will be happen. That's yeah.
And how is the interaction with the community when you go there? I mean, is it difficult or easy? Because I can imagine that small local communities maybe have some dynamics, some roles, and you know, to see a person from outside going there, dictating rules, maybe cannot be easy or not.
Yeah. It's depend on the information. Sometimes that it will be what is that? Apa ya, kehidupan life of there. So they will be prepared for that. But if not, sometimes it's difficult because we have to give them perfectly introduction to them, how the impact to yours. But if there needs because maybe for their work or something else, they will be here for, information from us. Okay.
Thank you.
Okay.
Any other question from the audience? Yeah, please.
My name is Yurika. I am a Magister of Medical Education student in UGM. I want to ask for Mr. Barandi first. Could GIS also integrate information about the rainfall to predict the dengue? Because that is very close correlation. And for Dr. Lisdrianto, thank you. I want to ask about, I already asked this question on the first day. I will ask it again about the practice of changing the toothpaste to charcoal toothpaste and eco enzyme and maybe other materials that's considered to be eco-friendly than the toothpaste that contains microplastic and the plastic packaging of the toothpaste. I want to ask your perspective about the safety and oral hygiene of these substances. Thank you.
Thank you, Mbak Yurika. Of course, that all the spatial information or the spatial data like rainfall, also the earthquake maybe, they can be integrated with the GIS. All of the information that they have a location and also have coordinate of them, they can integrate it. But sometimes we need to have the clearly methods to get the related between the rainfall and maybe for the malaria, like that. Dengue, okay. We have some graphics about the information between rainfall and also the case of the dengue. Yeah, they have the they have the pattern. Yeah. Well, we have make some case of that. Yeah, you can read from some journal about the dengue. Yeah, sometimes I was a supervisor of my student, and you can read for some case using the GIS for the dengue. Yeah, we use the rainfall, also temperature. Yeah, and also use the location of the vegetation, that the density of the vegetation, and also for the building. Because sometimes dengue will be happen with at the mosquitoes, the Aedes aegypti and Aedes albopictus. That are different habitat of the environment. So for the Aedes aegypti is sometimes the breeding place is in container in building, but in albopictus in the in the outside of the houses. We have the journal about that. Yeah. Wait a minute, because sometimes we need three parts of that, because we need the human that has the host of the virus and also the mosquitoes for the host. Yeah. Maybe not the dengue, but the habitat of the mosquitoes. Yeah, because if the dengue, we have to collect the mosquitoes, and we have to know the viruses in every mosquitoes. So we have to have the lab for that. But for the prepare, we just need when the Aedes will be grow up in some season. Mm-mm. Huh? Oh, yeah. Sometimes we have to know about the environment, like building, and then of the vegetation of that, and also sometimes that is difficult to get, but sometimes we have field survey also to know about the community. If the community periodically to collect the pupa at the house, I think it's better to know that the community is the vulnerability of the area is okay. So in GIS we don't just look for the rainfall, just not look the temperature, but also the social of the community. Yeah. If we have all the data and we can know and we know the algorithm of all of the part of variable that will be happen of the dengue, so we have to collect all of that. But if we less data for that, so the information will less also. Yeah. So if we the key if we have an area that we have to monitor and we have to get the all of the data that will what is that that will be related to the occurrer of the dengue. So I think we have to do. Yeah, we have to do that. So in Indonesia, all in Yogyakarta, we increase also the spatial data to give them good information for the community. Yeah. Yeah, yeah. Okay, thank you.
Okay, thank you for the question. So the question was about how is my personal opinion about the usage of toothpaste. So as I mentioned earlier, that actually from the dental point of view, oral health point of view, the most important thing of brushing teeth is not the toothpaste, but the physical or mechanical actions of brushing. So that mechanical action who uh, reducing the plaque from the teeth. So from the point of view of eco-friendly materials, so at least with toothpaste we can start to reduce the use of the detergent containing toothpaste. As I said, that there are also non-detergent containing toothpaste available because it's also reducing the use of the water. So you were also asking about what is the opinion if we are using more eco-friendly materials for toothbrushing, such as charcoal or maybe anything else, micro eco-enzyme, or also how is the use of plastics which can produce microplastics. So up until now, as far as I know, using the bristles from plastic is still the best way in reducing the plaque component in the surface of the teeth, because when we are using charcoal, then it's going to make some damage in the enamel area. And regarding the use of the effect of microplastic, yes, maybe this is something that we should consider. But up until now, I think the amount is very small, the effect. Yeah, if you don't agree, then you can do that. But actually, from my point of view, brushing teeth with what we have now is still the best way. Yeah.
Okay, thank you, Dr. Drian and Pak Barandi. Maybe we have one question from the audience here.
Check.
Hi, thank you for the opportunity. My name is Safa. I'm a third-year medicine student at VU in Amsterdam. I actually had a question about the mercury fillings, so the silver fillings. If people already have such a filling in their teeth, is it necessary to replace it, or is it not necessary, or are you guys really functioning on the yeah, that you guys are not doing it anymore? Is that the intention behind it, or are you guys also looking for replacing it? Thank you.
Yeah.
Okay,
Please, Dr. Dian.
thank you for the question. So if you have a silver filling, do you have to replace it right away now because of green dentistry? I would answer no, actually, because it's actually very safe. But the waste from the mercury itself, when we are mixing the materials before we put it inside the mouth, it's the dangerous one. So when it has already entered, as long as you don't have secondary caries, I mean, if the fillings is still intact, it doesn't have any additional lesions, then it's okay. It's very okay to have it there. So actually, from the literature, it's also become hazardous if the amalgams inside your mouth and then incinerate. If you have an incinerator for a corpse and it has the amalgam fillings, then it can cause some hazardous materials. But when it is inside your mouth and it's stable, it's okay. So we are not promoting green dentistry to replace all the fillings with composite. No, that's not our intention.
Yeah, so we have another question from the online participant. It's for Dr. Trian, I guess. So my name is Derara from Ambo University, Ethiopia. The question is, can lack of oral hygiene cause climate change, environment, and pollution? If so, which one could be practiced first to overcome it? Please, Dr. Trian.
Yeah, thank you for the question, Derara. So your question is, can lack of oral hygiene cause climate change, environmental pollution? So I would answer that what I was talking about with green dentistry is mainly from the dental treatments and oral hygiene practice, which can contribute to the carbon footprint in our world. So if you are asking the other way around, whether lack of oral hygiene can cause climate change, then I could not find a proper way that actually maybe it's not affecting climate change, but it can have an effect on your overall health or systemic health if you have not a good oral health, and also you cannot be socially well accepted if you have oral hygiene problems. So yeah, I think that's my question, Dr. Aryan.
Your answer maybe, not your question.
Oh yeah, my answer. Sorry.
Okay, thank you, Dr. Drian. And we have another online participant from Patimura University. Her name is Reza Dwi Lestari, and the question will be for Pak Barandi. So she has two questions. The first question is about could you provide some insight into whether there might be a connection between climate or geographic factors, since Kokap is located near the coastline and the malaria outbreak in the area? And the second question is, what action are the local government taking to address this issue? Perhaps the solution could also be beneficial if implemented in Maluku Island. Thank you.
Thank you, Dr. Aryan. Thank you, Reza Dwi Lestari from Patimura University for your question. That's right. That of course, the malaria is one of disease, but that is very related with the climate or geographic factors. Yeah, because look like at the Menoreh Hills. Menoreh Hills is Kokap also in part of the Kokap is part also of from Kulon Progo and Menoreh Hills. There is have the Black Sea in geological depth Black Sea, and the malaria will break out at when the rainfall is start or the rainfall will finish. Yeah, that is the very special in Kulon Progo. Maybe in Maluku or another country, country or the another area, maybe it's different. The story of the malaria occurrence. Because the Menoreh Hills have the vegetation that have the good habitat for the malaria, and also they have some stream that make the what is that, cebaan, I forget it, not trap, not what is that? Kayak batu yang genangan apa ya? Yeah, because that's impermeable. Brexit is impermeable material. So when the rainfall is highly and the pupa will be flow with the stream, but if the rainfall is not too much and very best for the breeding place, that ova and some mosquitoes can live in the location. So it's depend on the geographical factor like material and also the geology and something else. Maybe if you interest with this information about the Menoreh Hills, you can check it from the Barandi Google Scholar. That is the some journal about the malaria that happened in malaria at the Menoreh Hills. Okay. Second, about the local government taking to address these issues. Yeah. So this is my last research for my dissertations about the how to make how malaria can be eliminated. We have to join all the especially in government, because the government is have the program for that. If the one epidemiological location but in different program that use, so the malaria cannot be eliminated from endemic area. So in GIS we know about the spatial group decision support system. So we have integrated and make a program together to eliminate the malaria from the all of the area, not just in administration region, but we have to together give them some not also some program, but is integrated one to another. That is my question. Okay.
Yeah, thank you. Thank you, Pak Barandi, for the answers. Do we still have time for very short question? Yeah, maybe from the audience here, we still have time for one very short question, if you still have. No? Nobody wants to ask? Yeah, please.
Yes, thank you. My name is Elias Haulusi. I'm from Patimura University, and my question is, it might be not too short, I guess. So, first for Doctor, I want, yeah, yes, Doctor. I want to ask about your the system about. So, with that system of imagine about the highly endemic region. So I want to know about the delay time of delay time, and then the response before something could happen around the area that you predict with your tool. And the question for the next question is for Dr. Lisdrianto. So my home used to be a dentistry practice, so I have a lot of stuff in there, but for the modern day, I see that for your green dentistry idea, I see some of the dentists also use the radiographical imaging, and also for something like infrared. Yeah, but in your slide I can't see it, so I ask you about is it also bring some effect on the situation? That's all. Thank you.
Okay, thank you. Maybe for the question from Mas Elias, we can answer it like very briefly since we only have like 3 minutes left. Please, Pak Barandi and.
Okay, thank you, Mas Elias. We have to know perfectly about the what the happen with the malaria in region. Yeah, so after we know very good clear about the region and why the malaria happened to the location, so we can break down in algorithm and something else. So the key is we have to know perfectly about the location, but it needs some study before we make algorithm for GIS. Thank you.
And for the second question, Dr. Trian, please.
Okay, thank you very much, Elias. So you were asking about in dental clinic, can there be X-ray devices and also with infrared? As I mentioned actually in my presentation, now digital X-ray is available even though in dental clinics, so it's possible. However, if you want to have dental X-ray in your dental clinics, then you have to fulfill many requirements for protection. So at least your building should be following the regulation of having X-ray devices inside the building, as well as the infrared. If I'm not mistaken, maybe you would like to actually, in composite resins, we use light curing devices. It's an UV devices, so it is also almost in all the dental clinics use it, and it doesn't have any side effects for the health. So for infrared or light curing unit for restoration is very safe, but for the dental X-ray, then we should consider about the requirements of the building. Thank you.
Okay, thank you, Dr. Drian and Pak Barandi. We are now in the end. The end of the session. So, if I can summarize the lecture from our three speakers, global warming itself is having so many impact, especially in a global health. We hope that by reconsider that we can reduce our global warming effect or carbon footprint, then we can minimize the impact of global warming. So please give the big applause for our speakers here. And thank you for your attention. I will give the time back to Mas Yopi.
Check. Okay, so guys, once again, give big round of applause for our moderators and also our speakers. Bu Aryan, thank you so much. Pak Barandi and also Dr. Lisdrianto from Faculty of Dentistry. Thank you so much. You may return to your seats. And that was the end of the session of lecture sessions. You still have another session that is Puskesmas activity session. Start from tomorrow morning. Tomorrow morning, I hope you can gather in the faculty maximum at berapa Mbak Ren? What time? 7:45? 7:30. 7:30, okay. Because the distance between FKKMK, UGM, and Klomprogo around 60 kilometers or 1 hour. So we have to arrive there around at 9. So we will go from faculty around 7:45. So when we arrive in Puskesmas, not too afternoon, okay? So don't forget to bring all your belongings, your clothes, your medicines, your mosquito repellents, and other things. Don't forget to bring that. And for the detailed information, but we or our committee will inform you using your WhatsApp group. Okay. For our friends who join online, thank you so much for joining with us. The assignments is waiting for you. Okay. So you still also have assignment that you have to be done to get the certificate and also academic transcript. Okay, so see you tomorrow. If you have any question, don't hesitate to ask me, Mbak Reni, or Mbak Nia over there regarding the summer course. And especially for FUMC students, please stay here because on 3:30 you have a short sessions regarding your Global Health Indonesia program. Okay, so see you tomorrow and good afternoon, everyone.